Good morning, everybody. Am I audible? Anybody? Hello. Good morning to all the participants. Am I
Sir,
audible?
you're audible, sir.
Okay. So I am Dr. Murli, Deputy Director Public Health. This is my second lecture. The first one was about the healthcare system in India, and we had discussed in the previous session about the primary healthcare. What is the system which is being followed for primary healthcare in our country? Now we will continue look into the secondary healthcare, tertiary healthcare systems, and other aspects of healthcare system in our country. The participants, I think they can mute their phones or laptops. So, continuing from where we left last time, see, these are the various aspects of community-based primary healthcare system. So, an important slide which tells us what are all the key elements of this community primary healthcare system now which is being implemented through our health and wellness centers. As I told you last time, now the primary health centers, sub-centers, they have been renamed as health and wellness centers. They form the key elements of the primary healthcare system in our country. So, what are all the various aspects? We provide expanded service delivery. We have included a lot of services like mental health program for prevention of blindness, programs for improving hearing, programs for geriatric care, that is taking care of old people. So various services have been included into this primary healthcare service. That is the expanded service delivery. And then we have improved the diagnostics in all these centers. The infrastructure is being improved. And important thing is we have a robust IT system now. Now all the primary health centers and sub-centers, they have been provided with computers, with internet connection. So all these changes are going on at a rapid pace. And what are the expanded range of services being provided? We provide care in pregnancy and childbirth. We provide neonatal and infant healthcare services. Neonatal means a baby who is just born now. So we provide neonatal and infant healthcare services. We are providing childhood and adolescent connect icons. We are providing adolescent and childhood healthcare services, family planning, contraceptive services, and other reproductive healthcare services, management of communicable diseases, which includes a lot of other programs, including the national health programs, and management of common communicable diseases and outpatient care for acute simple illnesses and minor ailments, screening, prevention, control, and management of non communicable diseases, care for common ophthalmic and ENT problems, basic oral health care. This is again another important aspect of the healthcare system which is being provided now. Elderly and palliative healthcare services, emergency medical services, screening and basic management of mental health ailments. All these are the expanded range of services which are being provided in our health and wellness centers. And now I want to stress about one important program which is going on in our country with that is known as Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. So It is an insurance program launched by the government of India, where a cover of rupees 5 lakh per family is provided per year, and this is provided for all the families who are in the below the poverty line. And these benefits will be portable across the country, and around 85% of rural families and 60% of the urban families have been identified who will be the beneficiaries of this scheme. Under this scheme, they can get all the important medical facilities for the entire family, and the entire family is covered for a premium of 5 lakhs per year. And the program was launched on 25th December of 2018. So we will go to the other aspects now. So now, till now, we have been discussing the primary healthcare which is being provided in our country. Now, let us look into the secondary healthcare. Secondary healthcare is medical care which is provided by an expert or a specialist after being referred by a primary care physician. When the primary care physician refers a patient to the next level, the care is going to be provided by an expert or a specialist. This forms the secondary healthcare. And it is the second level of contact between the patient and the families with the healthcare system. And it is delivered through the community health centers and the district hospitals. So last time we had seen for every 1 lakh population, we have a community health center which is managed by a team of doctors. It is a center which has 30 beds. And these community health centers will be taking care of the needs of around 8 to 9 primary health centers situated around the community health center. The other secondary healthcare provider is the district hospital, which most of the districts in our country have now. And what happens in a secondary healthcare system? This secondary healthcare deals with more complex problems of physical and mental health as compared to the primary healthcare. The patient's serious illness or a health condition is treated here, and the care is given during childbirth, and radiology services are part of the secondary care. And the patients in the intensive care unit of a healthcare system also receive the secondary care. So, and it is the responsibility of the health department to make specialist doctors available in district hospitals for delivering the specialist healthcare services. And this referral system is a fundamental and necessary function of the healthcare system, and it is a two-way exchange of information. When a patient gets referred to a secondary level of healthcare, after being treated, the patient should be referred back to the primary healthcare system. So it is a two-way mechanism. First exchange of information is from the primary care doctor who referred the person to the specialist, and second exchange of information is from the specialist to the primary care doctor. And the next level will be the tertiary healthcare. Tertiary healthcare is the second referral level from a primary or a secondary care provider. It is provided to patients who are already admitted in the hospital. In some cases, these services are provided only by super specialty hospitals. A few examples of tertiary healthcare services are plastic surgery, neurosurgery, organ implants, treatment for cancer, treatment for burns, etc. All this will come under tertiary healthcare. And who are the people who are providing this tertiary level of healthcare? They are the medical colleges, the state hospitals, and the district hospitals which have been upgraded. All these are the centers which provide the tertiary healthcare for our country. And at times you can have a quaternary healthcare. where more specialized service is provided. Say, for example, now many centers are providing robotic surgeries for many ailments. So they can be grouped under what is known as the quaternary healthcare. And since it is very special in nature, it is not provided in all healthcare units. Only certain units which have all the facilities can provide this level of quaternary healthcare. This requires advanced levels of investigations and procedures, and maybe only few centers will be offering in a state, in every state. And the quaternary healthcare system has all the procedures available for healthcare, whereas tertiary care may not have specialized services for certain problems. And now coming to, so basically we have seen we have a primary healthcare system, a secondary healthcare system, a tertiary level of healthcare, and a quaternary level of healthcare. Now let us discuss some aspects of rural healthcare. The healthcare requirements of people living in rural areas are quite different from the requirements of people living in urban areas. This is because of the demographic, socio-economic, and geographic factors. And in rural areas, there is less access to healthcare. And again, we have to remember the poverty rate is high in rural areas, which is one of the biggest social determinants for health. And now the government has worked towards identifying the healthcare needs of the rural population and devising policies to meet these needs. So you have to understand the health problems in a rural setup will be quite different from those in a urban area. So usually the rural health, there people suffer from more communicable diseases like infectious diseases, which can be treated by providing appropriate antibiotics. Whereas in the urban setup, you will find that though people may not suffer more from infectious diseases, they will be suffering from more lifestyle related disorders like hypertension, diabetes. These are known as lifestyle disorders. They are non communicable diseases. So, the health problems in a rural area may be quite different from the health problems which are prevalent in a urban area. So the health planners have to devise methods in such a way the rural health problems will be attended to by the primary healthcare centers which are situated in the rural areas. And in our country, we all know that majority of the population is residing in rural area. So now, of late, the government of India has been focusing a lot on providing healthcare facilities for the rural population. And again, one aspect is the doctor-patient ratio in rural areas is much less. So now we have to take steps to post more doctors for rural areas so that the doctor patient ratio will improve in these rural areas. And why this situation is existing, because lot of medical and paramedical people are unwilling to be posted in rural areas. They try to continue to work in urban areas because they think that they'll have more facilities for personal reasons. So now we have to provide a situation where the health workers who are willing to work in rural areas, they should be provided all the facilities to lead a comfortable life. The type of healthcare required in rural areas depends on the working condition of the area, and the unemployment rates are much higher in rural areas compared to urban areas. Work in rural areas typically will include farming, fishing, mining, forestry. These are physical in nature, so the diseases which occur in these people will be quite different. And people in rural areas are more exposed to chemicals and smoke. And studies have shown that the incidence of suicide and poisoning are more prevalent in these areas. And due to lack of proper roads or water clogging, chemical waste from industries, agriculture, the life of people living in rural areas as affected by health problems are different from those in the urban areas. So the government now understands the medical needs of the rural areas, and we are trying to provide appropriate health. And this is the list of people who are involved in providing rural healthcare services. It includes the village health guide, trained DAI. DAI is the person who conducts delivery at home. And now we have discouraged deliveries being conducted at home, and we want all the deliveries to be conducted in the hospitals. No, now the role of trained DAIs is very little these days. The other important person working in an rural health setup is our auxiliary nurse midwife, who goes door to door, sees all the patients, finds out their problems. She gives them all the necessary help for the pregnant mother, the newborn child, the elderly. All these people are classy appropriate. So the accredited social health worker ASHA is the next person, and obviously doctors are there, and we also have multi-purpose health workers and Anganwadi workers. Anganwadi workers, though strictly they do not come under the health department, they belong to the social welfare department, but their activities are very much needed for a proper healthcare setup also. And coming to urban healthcare, so rural, we have seen rural area has its own set of problems which have to be tackled by the healthcare professionals. Similarly, the urban areas also have their own issues. There may be overcrowding in these urban areas. Mm, so the slums will be present in urban areas. So the slum population, the people who are living in these crowded slums, their healthcare needs will be very much different. So we have to concentrate on urban health also, keeping these things in mind. So in order to provide better healthcare facilities in urban areas, the environmental and social determinants of health are examined. This is done to identify the environment specific factors that may cause various health outcomes in urban people. And we are witnessing a rapid urbanization that reflects the impact of global forces on the health of urban population. And many non-government organizations have started to work with government to understand how urban living affects population health. They perform researches on whether urban living enhances population health or negatively affects health. There are underserved urban areas where the doctor-patient ratio is very high, almost 3,000 patients per physician. There are huge disparities in socioeconomic status of people in urban areas. Crime and violence is more in these areas. The fast lifestyle of urban areas is accompanied by psychological stress. And in densely populated urban areas, the physical environment also affects the population health. And there are less facilities and outdoor areas for exercise and sports. Such densely populated areas have lower air quality, which contributes to chronic diseases like asthma. And there are large slums with lack of proper sanitation, water, and electricity. And these slums also contribute to an increase in infectious diseases. Though urbanization equates to modernization, urban populations are healthier than their rural counterparts. At the same time, urbanization also poses increased health hazards and leads to chronic diseases. And current scenario, we experience a lot of deaths due to infections and chronic diseases. And due to people staying closer to one another in unhygienic environments, the chances for transmission of infection is very high in these urban areas. This urbanization has also led to poor living and working conditions, and immigration for food and money brings people from rural to urban areas. They suffer from lack of health insurance. They receive poor quality health care. So all these things are being corrected now with the introduction of the, as I told you, our Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. All this group of urban patients, they will be taken care of by this program, which has been launched by our government of India. And now let us look at some of the differences between rural healthcare and urban healthcare. Doctor population ratio is very low in a rural setup. It is quite high in urban health setup. Rural areas have less private hospitals, whereas urban areas have more private hospitals. And multi-speciality hospital may not be present in a rural setup, whereas in urban areas there are plenty of multi-speciality hospitals. And still, many medical officers may be unwilling to work in rural areas, whereas they'll be very much willing to work in urban areas. And for rural healthcare, Government of India introduced the National Rural Health Mission Program. Similarly, for urban healthcare, government had introduced the Urban Health Mission Program. And now both the rural health and urban mission programs have been combined as the National Health Mission Program. And as discussed earlier, three-fourths of our population is dependent on the rural healthcare system. And now let us look at some aspects of what is curative healthcare and what is preventive healthcare. Curative care heals the already existing illness or wounds, for example, giving antibiotics or chemotherapy to a patient. Curative care is given to a person after the occurrence of disease, and it is the most popular healthcare worldwide. Whereas preventive healthcare includes healthcare measures taken to prevent diseases. Now, the focus is more on prevention. That is why we are focusing more on immunization aspects, where various diseases can be prevented by proper vaccination, and we are laying more emphasis on naturopathy, yoga. That is why as I told you earlier, our primary healthcare centers have been named as health and wellness centers. Now, so we are more bothered about the health and well-being rather than treating a patient after he has developed a disease. Now, our idea is to prevent various diseases occurring in our population, and it includes anticipatory actions taken to prevent diseases, irrespective of whether they come under primary, secondary, or tertiary healthcare. People are advised to perform regular health checkups even if they are fit. Immunization and regular screening are used as measures to prevent disease occurrence. Different strategies are used for prevention at different levels. At the primary level, the strategies are immunizing against disease, maintaining healthy lifestyle, most important, avoiding alcohol consumption and smoking. At the secondary level, the strategies focus on identifying and addressing an existing disease before the occurrence of symptoms. For example, prescribing medications to a hypertensive person for high blood pressure so that the occurrence of kidney disease or heart ailment can be prevented. We all know that an untreated hypertension can ultimately damage the kidneys and the heart. At the tertiary level, the strategies focus on reducing the negative influence of the disease. These medications are given with the objective to maximize the remaining functions of a diseased patient. Government alone cannot manage the entire health system. We need the help of non-government organizations, and we need the help of various health programs to tackle all the problems, health related problems in our country. So let us see some of the programs which are going on. One most important program launched by the government of India in the year 1992, and it is still going on, is the reproductive and child health program. So, what is the objective of the program? It is to prevent the maternal deaths, to prevent stillbirths, prevent anemia during pregnancy, preventing eclampsia, preventing obstructed labor. These are the major objectives of this RCH program. And then we have an important national program for control of blindness, where the objective is to prevent blindness due to vitamin A deficiency, preventing blindness due to a disease called trachoma, preventing blindness due to cataract, preventing blindness due to refractory errors, and other preventing blindness due to other preventable causes. And then we all know the most important program, universal immunization program, where vaccines are given to all newborn children and the pregnant mothers. And the program prevents various important diseases like tuberculosis, diphtheria, pertussis, tetanus, measles, hepatitis B, polio. So these are the diseases which are being prevented by our immunization program. Of late, this program has included many more new vaccines, like we have included rotavirus vaccine, which prevents diarrhea caused by rotavirus. We have introduced Haemophilus B influenza vaccine and pneumococcal vaccine. These vaccines prevent the development of infection in the brain and pneumonia. So, a lot of new vaccines are being introduced, and very shortly, Government of India is planning to introduce the human papillomavirus vaccine to prevent cervical cancer. So, universal immunization program is an important program which all of you should remember. And then we have the National Tobacco Control Program, which aims to prevent lung cancer, which aims to prevent oropharyngeal cancer, and which is aiming to prevent other diseases due to tobacco consumption. And apart from these, there are many other programs recently which are being given a lot of importance. One is the National Mental Health Program, where the mental health care setup in our country is being improved by various measures. New centers are being set up for mental health care, and the primary health centers are being, the medical officers and the staff are being trained to take care of the needs of the mentally ill patients, and a lot of drugs are being provided in all the centers for needy patients who are suffering from mental health. So, mental health program is another important ongoing program. Another important program now is for palliative care and geriatric care. Now, a lot of patients who have recovered from cancer or who are suffering from cancer or other diseases, they need the palliative care. And now we don't have a very good setup for palliative care. Again, now stress is being given for training of medical officers and other staff members to provide better palliative care to people suffering in their areas. And again, we have programs to prevent hepatitis B. Then we have programs to uh, improve the oral health. The dental hygiene has to be improved. The dental problems of the patients have to be taken care of. So now we have a very good dental oral health program. Again, we have programs to identify deafness in children and old people. Again, that program is going on vigorously. So, a lot of new programs are being introduced, which will totally help our population to basically tackle all the health issues in our community. So, as and when new problems are identified, necessary steps are being taken to sort out these problems, basically through the health and wellness centers in our country, which are functioning throughout the country now. As on date, it is told that we have around 1.5 lakh health and wellness centers which are taking care of the health needs of our population. And telemedicine, again, I want to stress, is one important aspect which is being given a lot of importance by our Honorable Prime Minister also, where the rural population, they can easily get the services of specialists through this telemedicine. Even if they are not able to travel in person to a tertiary care center, with the help of telemedicine, the specialists can give very useful advice to people in rural areas. So telemedicine is gaining a lot of importance. And so various health programs are going on. And again, we have the National Vector-Borne Diseases Control Program. Previously, malaria had a different program, filaria had a different program. Now, all these programs have been integrated into a single program, which is known as the National Vector-Borne Disease Control Program, which will take care of prevention of malaria, filaria, dengue, chikungunya, and all these illnesses which are caused by vectors like mosquitoes. So that is another important healthcare program which is going on in our country. So, and we all know now medical tourism is also an important aspect, where on and off you keep reading that many patients from other countries visit our country for their healthcare needs for major illnesses like complicated heart disease or something like that. So now our some of the quaternary healthcare centers in our country, like in Chennai or Mumbai or Delhi, where the healthcare facilities are very good. Now they are catering to the needs of people from other countries. So now we are promoting what is known as a medical tourism, where people from other countries can visit our country to sort out their health issues. This again is an important aspect which is going on. And as such, the tertiary healthcare system in our country is also improving in a vast manner. So now most of the institutions are getting advanced laboratories and then advanced treatment methods. But again, during the COVID pandemic, we had learned a lot of lessons. Due to the pandemic, we have realized what are the shortcomings in our healthcare system, and in the past 3 years, a lot of efforts have been taken to improve these shortcomings. For example, during the COVID pandemic, most of the people required oxygen to survive. And then we realized many of the centers in our country did not have sufficient facilities to provide oxygen to the patient. So, a lot of steps have been taken to improve the number of oxygen beds in each institution. So, all the district hospitals, all the medical college hospitals, other bigger hospitals, they have been provided more facilities to provide more oxygen, like take care of the oxygen needs of the patient. That is one important improvement which has occurred following COVID. Again, we have increased the number of intensive care unit beds in most of the tertiary care hospitals, because in again during COVID there was a great demand for the ICU beds. So now following during COVID and now following the pandemic, lot of steps are being taken to increase the number of ICU beds in all of the district hospitals in our country. So the pandemic has taught us a lot of lessons. So that has led to various improvements in our healthcare system. So we can stop here. Any queries anybody can raise, or we can end the class here. Thank you. I think
Hello. Hello.
Yes, sir.
Uh, uh, Sir, I am Dr. Prakash Evanandam, going to give the next session. This session, 11 to 1. The organizer is there in the group. Am I audible? Hello.
Yes, sir.
Shall I start?
Yes, sir.
My slide is visible to you all. Excuse me, anyone reply to me?
Yes,
This
sir.
slide is
Slide is
visible.
visible, sir.
Okay, thank you, thank you. You can mute now. Hi, good morning to everyone who have gathered here for the MBA Hospital Management Training, that is the seminar program, and I'm very happy to be here as a part of resource person to deliver you a talk on prenatal diagnostic techniques. So myself, Dr. Prakash Yoganandam, G, Associate Professor, working in the Department of Pharmacognosy, College of Pharmacy, Mother Teresa Postgraduate and Research Institute of Health Sciences, the Government of Puducherry Institution, Puducherry. And I'm going to discuss you about the unit 3 of your hospital laws. There are many laws, already you have studied many. I'm going to give you a brief overview about three laws. The first law I'm going to talk with you is PNDT Act. It is simply called as PNDT Act, Prenatal Diagnostic Techniques Act 1994. This is otherwise called Regulation and Prevention of Misuse of Female Feticides Act. Okay, so this is very important act. Very recently came into the field of medicine, and during the year 1994 only. Before that, we know what was happening in our own nation and all over the world. Especially our own nation is a developing country where the people mentality want to abort female fetus, and they don't want to have a girl child in their family because of socio-economic reasons. There are many reasons behind that. One reason is the socio-economic reason. If any female or a girl baby born, so the problem associated with them is very vast, because we are very culturalistic people. We have a rich culture where we want to give much importance to the girl child from their born to their settlement, and till lifelong we have to serve them. So based on this mentality in the cultural behavior, many people in our nation want do not to have the female child in their family. So for that they will misuse. They always used to detect the sex of the child and misuse their the medical innovations available. So this was happened in the market, and later the government has taken much initiation to develop an act to regulate as well as to prevent the misuse of the prenatal diagnostic techniques available in the medical field. I hope many of you from medical field only, so you must able to understand what is called prenatal diagnostic techniques. There are many techniques available to detect the sex of the fetus, and we used to detect the sex of the fetus for many reasons, for many medical reasons. But most of the times it is misused, and we have heard from the daily newses, daily newspapers or magazines, and there are many even that is unqualified persons or even doctors. They have been caught by the people of the appropriate authority who can able to enforce this act in the country, right? So with this small introduction, now overview of this PNDT Act, I'm going to move to my slide one by one to inform or to discuss with you about this act. So this is very shortly called as PNDT Act. This act was ascended by the president on 20th September 1994. Okay, so this was the. There are many cases earlier which is enlightened or highlighted in the newspapers or magazines, and many people, social activists, women activists, they have protested against this kind of prenatal diagnostic techniques and save the girl child and save the fetus, girl child fetus. So this protest can taken into the president level, and president pass a bill to have an act to regulate and prevent the misuse of prenatal diagnostic techniques. Then it becomes an act, so which is forced with effect from 1st January 1996. Okay, even though the act was ascended by the president in the parliament on 20th September 1994, which is enacted or come into force from 1st January 1996. It takes around 2 years of time to become an act, and it is amended, and later on there is many amendment in the act, that is amendment in 2002 and 2003 also done to improvise this act and to regulate the prevention and misuse of the prenatal diagnostic techniques. This act was called as Prenatal Diagnostic Techniques Regulation Prevention of Misuse Act 1994, which is also known as Preconception and Prenatal Diagnostic Techniques Prohibition of Sex Selection Act. So the other name is also there for this act, which is described as Preconception and Prenatal Diagnostic Techniques. So in rural areas, especially the remote areas, the people are not having much education. They used to perform the preconception or prenatal diagnostic techniques to check the sex of the fetus, and this will become a relative issue in future. So this Prohibition of Sex Selection Act. So this again called as Prohibition of Sex Selection Act. So we don't have a choice. The God will give the choice, and we have to accept the God's choice. So that is the moral of the human creature. And we should not overseas. Then, if we overseas, then we will be caught by the authority appointed by this act, and we may put into jail or some other punishment by contravening this act. Definition of this act: prenatal or preconceptual diagnostic techniques. What are the techniques include in the prenatal diagnostic techniques? We know many techniques which is very widely available in the market. Many hospitals are having this facility: ultrasonography, fetoscopy, amniocentesis, chorionic villus sampling, cardocentesis, or testing any tissues or fluids of a man or a woman before or after conception. So this is basically done to check the nature of the man and woman for conception, as well as any medical or legal issues related the pregnancy. So to rule out the any genetic disorders associated with the fetus formations or any other legal issues where we want to check the fetus level and fetus sex and genetic codes, as well as if any fetal abnormalities are there. So there is a chance for abortion. So for medical reason only, medical and legal reason only, these techniques was enforced by the medical authorities. So this is called a prenatal or preconception diagnostic techniques. And the bill provides for that, means the bill of PNDT Act, which provides prohibition of preconception prenatal diagnostic techniques for determination of sex of fetus leading to female feticide. The main aim of the contravening of this act is to do female feticide, to control the girl child birth. So that is one of the that is medically or legally which is wrong. So that has to be the first primary aim, to prevent the female feticide. And prohibition of advertisement of PNDT techniques for reduction or determination of sex. So we that is there are many advertisement, sometimes which will flash in the WhatsApp group or even in the social medias or in newspaper and all earlier. So this was prevented by this act. Earlier, it was shown showcased in the open public by many social medias or by open medias. Then it has to be prevented. So by this act, permission and regulation of use of prenatal diagnostic techniques for purpose of detection of specific genetic abnormalities or disorders. So, who can be permitted to check the genetic abnormalities or disorders, and what are the regulations? So, there are certain regulations are laid down by the authority appointed by the government, specifically for using the prenatal diagnostic techniques. So, as already I mentioned in my introduction, to check the genetic abnormalities or disorders, which is primarily used the prenatal diagnostic techniques. Further, the regulation has been made permitting use of such techniques only under certain conditions by registered institutions. So they also designated certain centers or clinics or hospitals, and so as a registered institution where we can do the prenatal diagnostic techniques for the purpose of genetic abnormalities or disorders detections. And prohibition of sale of ultrasonography and other machines which is related to the checking of fetus, especially the genetic information as related to the sex information of the fetus, and punishment for violation of the provisions. So, any act which is enacted or which is enforced, which is regulated in the country, there will be the final end, and the final end will describe about the punishment, offences, and penalties of this act. So, if anyone contravene this act, what will be the punishment? What will be the procedure to withdraw or to stop or to make them in the jail or to put them in the jail for the offenses they committed. So this is the final end of this act. So these are the various provisions under this act. And what are the general terms under this act? General terms means they will give some definitions, and then this definition must be followed while we practicing this act. The first definition is genetic counseling center. That is, we call the sex determination center or scan center, any place which offers genetic counseling. Okay, so this is specifically the scan centers are made to check the genetic disorders, or what are the genetic problems are the people are and the conceptual people are having, how they can get resolved from their problems. So for that purpose only, which this was made, but later it is misused. Genetic clinics, which is otherwise called genetic clinics, any place which conducts prenatal diagnostic procedures. Okay, means ultrasonographic procedures, imaging centers, and portable machines. So usually they have the machine, and through which they do some invasive or non-invasive procedure by which they will check the development of fetus, and check the conceptions and prenatal diagnostic. Many of the diagnosis has been made by using these machines, and this kind of machines or equipments available in the center is called the genetic clinic center or genetic clinic. Genetic lab, any place which conducts analysis of sample received from genetic clinics. Okay, so not only by the ultrasonography, many of the lab they also detect the genetic abnormalities by taking sample of conception women or the conceived women, women's blood or urine are the major sample. So through which they also go for some testing and analysis to check out the rule out the abnormalities or disorders in the genetic code of the fetus or the women. Okay, so these are the general terms used under this act. Next, we move on to the registration. Registration means we cannot straight away start a clinic, genetic clinic or genetic lab or counseling center to check the abnormalities or the genetic code of the fetus. So for that, we must properly apply to the government, and the government will, upon receiving the application, they will check all the criteria, and thereby they will decide whether to allow you to do this procedure or not. That is called registration. Registration is mandatory whether the body is government, private, or voluntary or honorary. So even for a government hospitals where we need an ultrasonography and other equipments which is necessary, or the lab which is necessary for detecting the genetic abnormalities in the conceived women's or in the women's, we must able to, the government also has to apply and get the permission as a registered center for testing the genetic abnormalities. So, and private, they must apply, and a voluntary organization or honorary organization which are doing not for any mandatory for that is not for any money earning purpose, even though they have to be registered and they have to do the procedure upon the order. The organization has to be registered with an appropriate authority appointed by the state. Okay, state government will appoint a person who can authorize the genetic lab or genetic clinic or genetic counseling center. For Mumbai city, the municipal corporation is the concerned authority. If it is a corporate, and the corporation authority is the municipal corporation is the concerned authority. At the district level, chief medical officer (CMO) is the concerned authority to check the application and the request and to do the approval for registering the clinic as a genetic counseling center. Ultrasound machine, imaging machine, scanner, IVF center, any machine capable of detecting the sex of the fetus are to be registered. Mobile vehicles in which such machine is used is also to be registered. This is very, very important. Not only the static lab, if any mobile lab is developed or the equipment can be easily movable from one area to another area, this also has to be registered, and the movement register has to be maintained. Otherwise, they will get permission for one center and they will move to the many of the places and do the all misuse or this kind of these things. What are the requirements for doing the prenatal diagnostic techniques under this act? The act requires that an ultrasound clinic should be manned by a sonologist or radiologist or a registered medical practitioner having 6 month training or 1 year experience in sonography. In the current scenario, we have sonologist and radiologist. So DMRD people are there, and many of the courses are developed as a super specialty in medicine to do the medical radiation imaging. So we don't require any ordinary physician, medical practitioner. But even though this act allow a registered medical practitioner having 6 month training or 1 year experience in sonography, they are also eligible to do the procedure under this act, because in the remote area the sonologist or radiologist won't be available at ease like developed cities or in the metros. So the center can be owned by any person. So this is another one clue where we can understand that we need not require that is the license is not only granted to a sonologist or radiologist. Any person can own the license or to have the clinic on their own, but they should appoint a required technician or qualified person to do the procedures. He need not have the required qualification as long as he has employees who meet the qualification required by the act. They can appoint like a pharmacy. Pharmacy any person can own, but there will be a registered pharmacist who is called as a qualified person to handle the medicine. The same way, any person can have the genetic clinic or genetic lab or genetic counseling center on their own, but they should employ a person who meet the qualification required by this act. If the center has more than one ultrasound machine, each does not require a separate registration. So, in the same registration, you can mention the number of ultrasound machines or sonography and other that is imaging machines what you have in the lab and who are going to handle and the data of installation, making, and everything has to be filled up and get the permissions. Then the register has to be maintained. Regulation of prenatal diagnostic techniques and how the act regulate the practice of this act throughout our nations. No place shall be used for conducting prenatal diagnostic techniques except for the purpose mentioned in the act. So the purpose of the developing the PNDT technique is already we discussed to check the genetic abnormalities and prevention of genetic abnormalities. So beyond that, we should not indulge in any other activities. So that was mentioned to regulate this act. Techniques for certain abnormalities and what case you can able to check the abnormalities. Nowadays, each and everyone is checking the abnormalities because we couldn't able to differentiate the people who is having genetically abnormal child or not. So, in many of the cases, the physician or the gynecologist they used to advise to check the any genetic abnormalities during the course of pregnancy, just to have mm, just to have what vigilant on the development of fetus, not for any other sexual determination. And purposely, it is being done for certain women who is having chromosomal abnormalities, genetic metabolic disorders, hemoglobinopathies, sex-linked genetic diseases. So the people who are known to have these abnormalities must have able to check their fetus status through the prenatal diagnostic techniques. So on this purpose we can do, and this is the regulation, and no other that is conditions where the person is allowed to do the prenatal diagnostic techniques. And techniques are to be conducted only under following conditions. What are the conditions? It is, and the woman who is who is attaining more than 35 years of age during the conception of a child. Okay, so this is one sign where the development of fetus may have some abnormalities. So they are allowed to are permitted to do the prenatal diagnostic techniques. And a woman undergone two or more abortion in the natural conceptions. Okay, so definitely there may be chances for fetal abnormalities that has to be checked through the prenatal diagnostic techniques. And a person who exposed to teratogenic agents. So you all know teratogenic agents are nothing but agents which cause abortion. Teratogens are agents or chemicals or food which cause abortion or fetal abnormalities during pregnancy. So certainly or knowingly or unknowingly, the conceived woman may or may not have some teratogenic substances that has to be prevented by means of checking prenatal diagnostic techniques. Okay, so these are the conditions. The chromosomal abnormality conditions are the agings or they already they developed conceptions. So during this time, they may able to do the prenatal diagnostic techniques. Okay. So that's all about the regulation of this act, and the next is we are moving to the registration. Okay, how a concern or a firm can able to register as a PNDT center. So for that they have to fill up a form called Form A. So there are many forms are there under this act. First Form A is called application. So this is called a prescribed application form, application form, which is to be filled in duplicate. Okay. So everywhere it is common. When we go for any approach, we must be able to give a letter that is called application. So it is these data are already asked by a prescribed application form. We have to be filled up in duplicate. Affidavit. Also, we have to give an affidavit. Affidavit is a government undertaking. Undertaking between the person who is going to own the firm, PNTT firm, as well, to the government. That is called the undertaking between the center to the government. Affidavit assuring that the center will not indulge in any sex determination. Okay, so this is very important thing that an affidavit has to be made by the Indian government stamp stating that the center will not violate any rules and regulations of this act, and along with the form, filled up form in duplicate, and affidavit, signed affidavit, and along with that you have to pay the requisite registration fee to be called as a PNDT center. Process of certification. So once the application is received by the government authority, the authority already we discussed in the municipal level, the municipal corporation officer, or in the district level, that is CMO, chief medical officer. So who are the in charge for receiving the application, scrutinizing the applications, and granting the approval to conduct the PNDT. Mm, the committee holds an inquiry to verify that the applicant has complied with all the requirements under the Act, and then grants the certificate. Okay. So what are the compliance has to be made, and then the premises has to be mentioned. It's a prenatal diagnostic center, and in the center entry itself, the warning signs and the information about the prenatal diagnostic techniques, do's and don'ts, warnings, cautions, everything to be mentioned in English as well as in the local language. To understand the person who is entering into the premises is meant only for medical diagnosis, not for any sexual determination and abortion. So this has to be checked by the committee. So it may be a, three months committee or 5 members committee. So the members will go and inspect all those things, the machine equipments available, and the qualified persons appointed, and the owners details, and the premises details, everything. And nowadays it is required to have a CCTV camera in the each and every area to check whether uh, they are informing the sex of the fetus or not. Okay. So upon checking, 2 copies of certificates are given, of which one is to be displayed at a conspicuous place in the clinics. So in a well laminated signboard or printed matter has to be displayed in the entry places, or in well visible places about the approval of the clinics. So this is like a pharmacy only. In pharmacy also the same thing has to be displayed in the pharmacy. Everyone can able to view the registration of the pharmacist and the qualified person who is working in the pharmacist. This certificate is not transferable. We cannot easily transfer from one person to another person. In the event of change of ownership, the new owner has to register afresh. So there is no any person to person exchange. So each and every time when we are going to exchange the ownership from one person to another person, that has also has to be applied. That is, the previous certificate has to be surrendered, and a new ownership certificate has to be generated. So this is the usual procedure under this act. The registration certificate must mention the number of ultrasound machine in the center, including the portable machine. Already we discussed. So where we have to mention what, not only the number, the make, model, that it is imported or exported, and date of installation, and AMC being done, and the qualified person, the cost of the machines, and how many machines, and how many portable machines are available in the clinics. Next, renewal of registration. And once it is registered as a PNDT center, it is not mean that you can have it your lifelong. The certificate is valid only for 5 years, and so you have to be very vigilant. And every once in every 5 years, you have to again renew your certificate by applying in a form, and again you have to give the fee, and they will inspect, and the renewal certificate will be given. Application for renewal has to be made 30 days before the date of expiry in the prescribed Form A. The same Form A has to be used for renewal also. So in the form, it's new application as well as renewal is there. So you have to strike out and tick the required columns. Cancellation or suspension of registration. Okay. So on what condition the registration can be cancelled or suspended? On receipt of a complaint, the authority can issue a show cause notice to the center. Okay, so maybe the social activist or women activist or any person can complain about the misuse of the center to the government. Upon receiving the complaint, either by oral or by WhatsApp message or even by a letter or a petition, written petition, immediately the authority who has the power to go and check the PNDT center can make a show cause notice to the center after giving the center an opportunity to defend itself. Okay, so they have the chance to defend about the queries or petition made against them. So the authority can either suspend or cancel the registration depending on the gravity of the offense. Okay, so what kind of offense they made? So it may be a minor, or it may be a moderate problem issue, or it is very legally, which is a very high issue. So in that case, the gravity is very high. Immediately, the approval is cancelled, and the center is sealed, and it is the instruments are seized by the government. So, so this is the regulation and enforcement of this act. Provision for appeal. The center can appeal against the suspension or cancellation within 70 days. So after sealing the center, if the order was issued by the authority at the sub-district level, then the appeal may be made to the appropriate authority at the district level. If the order was issued by the authority at the district level, then the appeal may be made to the appropriate authority at the state level, and so on. Means so you have to apply and appeal the authority who is higher than the person who gave the permission registration for your clinics. Okay, so like that you have to go and appeal the higher order to clarify the or to counsel your what a punishment or mistake you committed, and to get relieved from the punishments. Prohibitions of centers. What are the prohibitions? Prohibitions, what are the prohibitions? What are the preventions? No center shall conduct a prenatal test unless it is registered. So there are many cases we have read from the newspapers. Many of the village areas, rural areas, even the town, in the city, there is a center. They are not at all registered as a PNDT center. They only meant for checking the that is genetic sex of the fetus, and to reveal to the that is parents. So this is very wrong aspect. So if any center without registration, they are checking this PMDT, prenatal diagnostic, doing the procedure, they will be prohibited. They will be caught by the government as well as by the police, and they have to be sued in the court, and they put into imprisonment. And next prohibition is employ persons not having requisite qualifications. Already we studied what are the requisite qualifications. One is sonologist or radiologist, or even a medical practitioner, MBBS doctor who is having 6 month training or 1 year experience on the field of checking the prenatal diagnostic, prenatal things. And apart from any person, but if you see in the market, 8th standard completed person, 10th standard completed person are not even qualified. RAMP doctor, they put their name as a doctor, and many of the homeopathic physician, or even a Siddha physician, a pharmacist, or a medical nurse in Tiruvannamalai district, in South Tamil Nadu, like Madurai, Kumbakonam, many areas, there are people, they are even literate, they have very less qualification. They do the PNDT, and they will be caught by the police or by the directors of the health officials of the states. Conduct prenatal test except for the purpose was specified in the act. Already we discussed what are the specific purpose we are doing the prenatal test for chromosomal abnormalities or many other abnormalities, and a woman conceiving after 35 years of age, or woman is already having two or more natural abortions, or many conditions we studied. Beyond the conditions, any person is conducting the prenatal test, that is medically illegal or unethical. Definitely, they will be caught. The major purpose is to check the fetus sex only. So that is the major thing here. And no center shall conduct a prenatal test for sex determination. So it is straight away said here, and no person shall open a center performing prenatal test unless it is registered. So no person shall open a center performing prenatal test unless it is registered. So our country is very well structured country, and we have laws and ethos. So we must be following, and we should apply in a proper form, and we have to wait till the registration certificate has to be granted. Still, until you have to wait. If you opened before even applying, or before applying, or after applying, that is prohibited. No qualified person shall perform prenatal test at a place which is not registered. So maybe the person who performed the prenatal diagnostic test, or maybe the sonologist or a qualified person, but the center is not having any registration, and it is also being prevented. This has important implication for sonologists doing portable ultrasounds, because portable ultrasound, which is one machine which can be able to move from one area to another area, so easily we can move the instrument and do the PMDT, but it is offensed. It is an offense. It is prohibited. The sonologist should neither detect or nor reveal the sex of the fetus, nor communicate sex of the fetus by words, by signs, or by any other manners. So that is why I said nowadays it is been mandatory to have a CCTV camera to check any other this kind of activities are going. That is communicating the sex of fetus by word or by sign or by any other manner during the scanning. So accordingly, the CCTV camera has to be fixed. Then how the doctor is communicating to the patient as well as to the attendants or the patient's relatives. No person shall conduct a procedure unless written consent is obtained. This is very, very important. Each and everyone have to be get a written consent about their PNDT checkup. So this form will be there. Then the form, prescribed form, has to be filled up by the patient, and it has to be signed by the patient as well as the patient attender, relatives, or the husband. He then again it has to be maintained. So the written consent is very, very important. Prohibition of advertisement. And next, it is illegal for any person or organization to advertise regarding facilities for prenatal sex determinations. So you should not propagate it. You have as a clinic stating this determination of sex. So which is coming under prohibition of advertisement. So this kind of advertisement is totally prohibited to the public to inform about the center as well as their duty over the center. But every center shall display a notice of the copy of Act and its rules in English or local language visibly, and this has to be read by an ordinary person by its own language. If it is Hindi, Hindi; Tamil, it is Tamil. So wherever we have the center, the local language has to be identified, and all the rules which was stated by the act is also written in the local language to understand a common public, stating that why this center is created, what is the motto of the center clinic, and what to be done, and what do not to be done, don't be done on the clinics. And we discussed about various forms. Only one form we discussed, that is Form A, application for registration and renewal of the registered center. So this already we discussed. So the other form, which is available under this act, and the form we must able to know that, and what is the role of the form. Form B is certificate of registration, which is given in duplicate. One is kept by in the file, and another one is the displayed as a note, displayed in the center visibly to understand that the premises is allowed to do the PNDT. Next, Form C. Form C is a rejection of application. Rejection of application. So, upon receiving the application, the application is not correct, or which is not intended for the purpose of medical reasons. Then, in Form C has to be issued to the center, stating that your application has been rejected so and so on the following date and for the following reasons. Next form under this act is Form D, maintenance of records by Genetic Counseling Center. So, Genetic Counseling Center is one. Already we discussed about the definition of Genetic Counseling Center. So, Form D is a form which is maintained as a record. Form E and F also is the record, maintenance of record by different PNDT form. So this form may be genetic laboratory or genetic clinic. Already we discussed genetic clinic, genetic laboratory, genetic counseling center. So three kind of PNDT centers are there. So that we must understand, genetic counseling center is one kind of PNDT center. Another one is a genetic laboratory, and another one is a genetic clinic. So based on that, the form D, E, and F has to be maintained. There is a little difference between the laboratory counseling center to the clinic. So accordingly, the record, the form details also there. So that has to be maintained by the center. It has to be inspected at any time, and the form has to be checked. And without form, you cannot be able to do the procedure. So the maintenance of form is very, very important. Form G, form of consent. So the written consent has to be get from the patient as well as from their attenders. So that form is also has to be maintained. Form H, maintenance of permanent record of application for registration. Okay, permanent record of applications for registrations. Okay, they have to maintain a permanent record starting from the day of initiation of the firm, and how long it is being run, and each and every day activity, how many cases are there, and what kind of screening they have come, and what is the details of the form D, R, E, R, F, as well as form G. Any D, E, F, any one form it will be there, and G form will be there. So that has to be maintained in form H. Maintaining proper documents is very important to register as well as renewal, and to conduct the PNDT. Form G and F are the prescribed format in which genetic and ultrasound clinic have to be maintained records. Okay, already we discussed. Every center has to maintain a register called Form F and G for every patient. So, what is F and G? F is the maintenance record by the center, and G is the form of consent. So, consent form and their detailed form, and upon the consent form they able to do the PNDT procedure. No, so what kind of procedure are made for the particular consent has to be made. So form F and G is the inseparable for any kind of PNDT center. Form G is the pregnant lady gives an undertaking that she does not want to know the sex of the fetus. You have to educate them, and you have to get consent from them. The sonologist also sign a declaration that he or she has neither director nor disclosed the sex of the fetus to anybody. So they should not disclose the sex of the fetus even to the patient as well as to the patient attender. They are very vigorous or eagerly asking the doctor what is the sex of the fetus, and they will act in any kind of form to know the sex of the fetus. But at any cost, the sonologist or the radiologist or the practitioner should not discuss the sex of the fetus. Form F. What is Form F? Already we discussed. Form F is the maintenance of records by the genetic clinics. So what will be there in the Form F? In the Form F, the details of the patient will be there, name and address, and the registration number of the clinic is the first thing where they did the procedure. Patient name, ultimately it is required, and age of the patient, husband name of the patient, address and telephone number, referring doctor. So they may come straight away, or most of the times 99% they will be referred by a doctor to check the abnormalities. So referring doctor name, weeks of pregnancy, how many weeks of pregnancy? It may be checked in the first trimester, or second trimester, or third trimester. So that has to be mentioned. And the history of genetic diseases in family. Any genetic diseases already is there are noted, so that has to be mentioned in the form. That is the main reason for doing the PNDT. Indication for prenatal diagnostic techniques. So, on what the indication you are doing the prenatal diagnosis? Majority of the times, the indication chromosomal abnormalities and teratogenic effects. So that has to be maintained. Is there are chance for abortion, or there are chance for chromosomal abnormalities. So the week of pregnancy and the particular week of pregnancy, the for the particular indication, the PNDT can be done. Procedure carried out on patient. It may be invasive or non-invasive. Already we discussed. So whatever the procedure, what you followed. So that has to be maintained in Form F. Any complication of the procedures during the procedure, what complication has occurred? Result of the test. So they will not discuss here the sex. For the sex purpose, it is not being done. That we have to be very clearly understand. So this is for any chromosomal abnormalities. So the result may be nil, no, or yes. Or yes means what kind of abnormality will be there and how it is going to be overcome. To whom the result was conveyed to? Usually, the result was conveyed to the doctor, referred doctor, not to anybody. Sometimes, if required, it is discussed, conveyed to the patient as well as the patient attendant. And was MTP advised or conducted when? So, what is called MTP, medical termination of pregnancy. So, based on the result, there may be a chance for aborting the child due to abrasive chromosomal abnormalities. Definitely, the child has to be evacuated or the fetus has to be evacuated. So that has to be advised. So on what date it has to be conducted, everything is there. So that is why I said Form F is very, very important. Form F or Form E or Form D. So based on the clinic level, the forms are there. These forms are very important forms, are confidential forms, how to be maintained by the firm, the PNDT center, for for their procedures, for their approval and renewal. A complete report of all pregnancy-related procedures done by the center in each month has to be sent to the authorities by the fifth day of the following month. So it may be one cases or five cases or 100 cases. So each cases you have to describe the patient name and the referral doctor name and what is the purpose they have done the PNDT and what is the result of the PNDT. Everything has to be maintained and has to be sent to the as a report to the government. Intimation of change in employees, place or equipments within 30 days. So there may be chances. A doctor may change, or the sonologist may change, or the places maybe you may be in the rented place. You may move from one place to another places, or you can have a new equipment. You can disperse the old equipment. So these all kind of information has to be intimated to the government. All records have to be preserved for a minimum period of 2 years, or in the event of any legal proceedings, till the final disposal of the legal proceedings. So, minimum 2 years you have to maintain and you have to disperse the records, or you have to maintain until the any legal case is there against the abortion or against the maybe the babies, that is the woman conceived underage, or the woman conceived at during any of the raping cases, or any of the assault or any of the things. So there will be legal proceedings. So it is sued in the court by the patient or by the activist or any of the interested person. So in this case, the records has to be maintained until the case is over. Search and seizure. Okay, the authorities are empowered. Who are the authorities? The applicant, that is the constitution of a committee, there the state level or the municipal level. So they can go and inspect the premises at any time. They can check the record at any time, and they can search and seize the instruments or the place even. The authorities are empowered to enter and search all the reasonable at all the reasonable times any genetic clinic, genetic lab, or ultrasound clinic. They can inspect all the documents like register, consent forms, referral slips, pamphlets, equipments, and they can seize and seal if there is a reason to believe that any offense is being committed. So the inspection may be happened may happen with intimation or without intimation based on the severity of the petition or the complaints received. Regulatory and supervisory authorities. Who are the regulatory authorities? Who are the supervisory authorities of the PNDT clinics? So, constitution of the state supervisory authority, health minister is the chairman and assisted by officials and non-officials. Health minister, health secretary, and the director of the medical services, and the deputy director of the public health. So they will be in the order of the constitution and so of the state supervisory board. Functions of the state supervisory board to create public awareness against the practice of preconception sex selection and prenatal determination of sex of fetus leading to female feticide. So either they will check during the conception, pre-conception itself, or after the conception whether they want to know whether they have any female child or not. So if it is female child, then immediately they will do the feticide. So this has to be prevented, and this is a very wrong practice. So the main aim of the state supervisory board is to educate the public about the sex determination. Next is to review activities of appropriate authorities and recommend appropriate actions, and to monitor the implementation of provisions of the Act, to send the consolidated reports to the central government. So, each state government has its own health minister as well as healthcare officials. So, they are all the government people, and they will be forming a committee and are constituting a board. This board will do the procedure, and also they will give the report to the central government. Appropriate authorities, state appropriate authorities, which consist of three members. Additional Director of Health Services is the chairperson. Additional Director of Health Services, DMS, and one officer from Law Department. One officer from Law Department. Other eminent women activists are the two additional members. Okay, so women activists are always are human right peoples, human right commission peoples, are social welfare people, especially women social welfare people, are involved in the state appropriate authority to regulate the rules and laws regarding to PNDT. District or corporation appropriate authority, already we discussed. Civil surgeon, that is our health officers of the corporation, are designed as an appropriate authority for their respective areas. Taluka or sub district authority, medical superintendent of rural hospitals are designated as appropriate authority for their respective areas. Powers of the appropriate authorities. What is the power? There are different level of appropriate authorities. If it is in taluka, rural area, medical superintendent. District area, civil surgeon. State level, which is the additional director of health services. State level, again, health minister. So many people are holding the power as an appropriate authority to enforce the laws in the nations, in the country. The first power is registration of institution. So they will be receiving the application. They will be satisfying themselves about upon receiving the applications, and they will grant the registration certificate to the individual premises or firms who do the PNDT. Seal and seize. So they have the power to go and check upon any complaint, or even by themselves on their own interest to go and check all the records, machineries, equipments, employees, owner, and the premises. And if they found not satisfactory, they can seal and seize the particular form. Power to search and seize records. So they can view the records at any time, at any records. Cancellation or suspension of registration upon satisfaction. So if they are not satisfied by their appealing, it may be cancelled, or if they satisfied, the suspension can be removed, and again the center can start do the PNDT. We are coming to the end of the this act, offences and penalties. All offences under this act are, one is cognizable, another one is the non-bailable, another one is the non-compoundable. So arrest can be made without any warrant. So this is one speciality of the act. Getting bail is not the right of the accused. So non-bailable punishment they can able to give. He can give a arrest warrant on non-bailable punishment, non-bailable case. So and non-compoundable. No settlement between the parties is possible to drop the criminal charges. So this also, there is no, if any mistakes are done and if you give any settlement, this can be withdrawn. So this is not in the case like PNDT Act. And if a medical practitioner is found guilty of conducting prenatal sex determination, he or she shall be punished with imprisonment up to 3 years jail or fine up to 50,000 and removal of name from the state medical council register for 5 years for the first time of offense. If they commit the same offense subsequently, on subsequent conviction, which entertained imprisonment up to 5 years and fine up to 1 lakh and permanent removal of name from the register. Very, very important one. Pathetic if any practitioner are indulging in this kind of offenses. Contravention of provisions by the practitioners or the owner. See, any person who owns, not a doctor, the owner, who may be medically, that is, who may be a normal person or a doctor even, owns a center or clinic laboratory or the medical practitioner who contravenes provision shall be punishable with the imprisonment up to 3 years and with the fine up to 10,000 and subsequent conviction with imprisonment up to 5 years and with the fine up to 50,000. So what we have to understand here, the punishment is given separately for the practitioner who is contravening the act as well as the owner of the farm also has to be given a punishment. That's all. They're coming to the conclusion. So what we discussed till now, there are serious social implications due to imbalance in sex ratio. So this was implemented. This act is done by the health department. Violation of provisions by professional colleagues. Okay, professional colleagues are nothing but a sonologist, radiologist, or a medical physician who is doing the violation. Ignorance about law is not an excuse. Okay, so anybody who contravene doing the PNDT, definitely they have to be caught by the regulatory authority of the state as well as the center, and there is no excuse who are going under non-bailable arrest warrant and imprisonment. There are heavy penalties for offenders, including doctors, patients, and relatives. Powers are given to appropriate authorities, so they can go at any time without notice or with the notice, and they can get satisfied or dissatisfied. They can see lenses, they can review the record, anything they can do. So this is the sole power which is given to the regulating authorities. Monitoring is by district and state authorities as well as center. Honorable Supreme Court and High Court give directives and guidelines. So Supreme Court and High Court can directly give the guidelines for this act. So this act is very, very interesting one, and which is enforced in our country. So thereby only we can able to maintain the sex ratio and we can able to save the girl child. So that is the main motto of the act. Ultimate objective is no determination of sex at any cost, at any level. You should not determine the sex at any cost, at any level. So that is the ultimate objective of the prenatal diagnostic techniques, prevention and regulations of Act 1990, 94. So that's all. I have completed one law, that is PNDT Act under the health laws. We are going to the assessment now. Are you there? Anybody is there in the class? Now you can. Yeah, excuse me.
Yes, sir.
Introduce about yourself.
Sir, I am Shivaranjani, working as a nursing officer in IGMC Medical College, Pondicherry, sir. Class was very nice, sir, and very informative.
Okay, ma. We are
Sure,
going for
sir.
an assessment. Actually, I have only 4 questions just to check how you understand this topic, just as one of the discussion part. Can we go for this session?
Sir, I may not be answering all the questions.
No problem. It is not mandatory. You should say the correct answer. You just check. That is, try it. Okay.
Sure, sir.
Okay. The Prenatal Diagnostic Techniques Act, that is PNDT Act 1994, was brought into operation from 1st January dash.
No, sir,
The
I am
options
not
are already
confused on dates, sir. Please, sir.
1994.
1994. Somebody is telling 1994. Any other guess?
No,
Any
sir.
other guess? No. Actually, I told in the introduction, in 1994 was initiated, but it is fully enforced in 1996. The answer is 1996.
Okay, sir.
So it takes 2 years of time to become as an act. Okay, next assessment is the Prenatal Diagnostic Technique Act 1994 was enacted to check female feticide.
This is true or false, sir?
Yes. What will be the
True.
answer? Either true or false.
True, sir.
True. Yeah, you are correct. It is true.
Yes, sir.
The main aim of the act to prevent the female feticide.
Yes, sir.
Person carrying out prenatal diagnostic procedure will communicate to the women concerned or her relatives the sex of the fetus by words, by signs, or by any other manner. It is yes or no question.
No.
They should not,
False?
sir. They should not
Yeah,
disclose.
no. Yes, no is the answer, correct. The central government will constitute a board to be known as dashboard to exercise the powers conferred on the board. What is the central government board? So we discussed during the sessions, the state government has to give the status of the what was the procedure they have done to the central government periodically to on board. The board name is Central Supervisory Board.
Okay, sir.
Central Supervisory Board. So
Yes, sir.
each state government has to pass on the message to the Central Supervisory Board. Okay.
Okay, sir.
Thank you all.
Thank you.
Actually, we have to, thank you for your patient listening. We'll take a break of 10 minutes and shall we move on to the next session
Sure, sir.
after that? 10 or 15 minutes. Now it is in my watch, it is 12:04. You just
Yes, sir.
take it
Sure.
as 12:05. 12,
Okay.
20, we will assemble again. Okay.
Okay,
Take
sir.
a
Thank you.
break and we will assemble again. Okay. Thank you.
Sure, sir.
Thank you. Good afternoon. Anyone in the group will just reply to me so that I can able to continue my talk. Good afternoon. Are you there? Any one of you unmute and reply to me so that I can able to deliver my, yeah, yes. Okay. Thank you. Deepthi is answering yes, sir. Okay. I'm going to share my presentation now. Is this okay? Okay. Thank you. Uh, Good afternoon, everyone. Once again, I am very thankful to you to join me in this class. So, from morning 11 a.m. onwards, we are discussing about the health laws. Health laws, it is your third semester. Uh, what is the paper? I think healthcare laws, ethics, and medical terminology. So it is a paper, and we are discussing about the unit 3, laws pertaining to hospitals. Laws pertaining to hospitals. Previously, we discussed about the prenatal diagnostic techniques laws, PNDT Act. It's a very important act. That is also in the year 1994, and we are going to discuss now. It is the Transplantation of Humans Act, 1994. Both are in the same year, but actually, we discussed the PNDT enforced to the nation in the year 1996. Of course, it was initiated in 94, but it was enforced fully in the year 1996. So, in this act, the Transplantation of Human Organs Act, THOA, TOA. Excuse me, I am having a line. Sir, சொல்லுங்க சார். சார் 10 minutes break கொடுத்தேன். நான் கண்டினியூஸா சொல்லிட்டேன். Yes, sir. Okay. Thank you. So this act is called the Transplantation of Human Organs Act, TOA 1994. So we are going to discuss about this act. So what is the primary aim of this act, and we are going to discuss about the authority of removal of human organs. We are going to study about transplantation of human organs. Definitely it has to be removed from one human to the another human, and we are going to discuss about what are the authorities behind the removal of the human organs and various regulations of hospitals for removing organs. Okay, so through this act, the regulation was made, and on what procedure the human organs can be transplanted, and list out the regulation of hospitals for removing the organs, and we are going to discuss about the registration of hospitals engaged in removal of human organs. So how a hospital can able to register themselves as a transplantation hospitals, and we are also going to discuss about the various offences and penalties related to removal of human organs. So with this, we are going to stop, and the remaining thing we are going to discuss in the next class, which is going to be held on 22nd afternoon. So I'm going to come once again on 22nd afternoon, the remaining portion of this act and medical negligence. One more act is there. So both these act we are going to discuss about on 22nd. So today in this session, we are going to discuss about the TOA 1994. What are the predecessors of this act? What are the previous act for outcome of this act? Okay, so before the human transplantation, the transplantation of human act, there are many different acts are there through which the transplantation of human organs has been happened. One is the ICE Act 1982, ICE Act 1982, through which the eye donation was happened, and Air Drum and Air Bones Act 1982. So this is another act through which the deaf and dumb are treated. So these two act and laws are enforced in the Union Territory of Delhi. So the Union Territory of Delhi. So once you want to do any eye transplantation, you have to go up to Delhi and you have to do the procedure and you have to come back. So this is the previous form of this act. And there is another one act which was practiced in Maharashtra Kidney Transplantation Act 1982 and Bombay Corneal Grafting Act 1957. This is again two acts which is practiced in a particular territory, that is Maharashtra and Mumbai. So these two acts help to transplant kidneys and cornea. Cornea means that is eye transplantation grafting. So these two acts was practiced as a pre-act of the TOA. Transplantation of Human Organs Bill was passed in the year 1992 and it is introduced in Lok Sabha and accepted 20th August 1992. The bill was assented by the President on 8th July 1994 and it became the Transplantation of Human Organs Act 1994. Human Act 1994. Just a minute. So these are the various forms of the Transplantation of Humans Act 1994. So earlier there are only two acts to transplant eye and kidney, and you all know nowadays many of the organs, like from the live humans or from the dead humans also, it is being transplanted, and we are seeing this news from newspapers and from the news and social medias. Many transplantation has been happened, the liver and then other part of the human body is also transplanted. But earlier, only two vital organs were transplanted. That is, one is eye, and the next one is the kidney. So based on the these two act from the two different territories, so it was compiled and it has to be passed a bill and it has to be come to a kind of Transplantation of Human Organs Act, a common act 1994 by the government. So this act describes about various definition of the person who involved in this act. The one is a donor. So the person who is donating the organs is called donors. So means a person not less than 18 years of age. This has to be remembered. 18 years of age who voluntarily authorizes removal of any of his organs for therapeutic purposes is called a donor. Okay, so donor, and next is the hospital. Hospital is a premises. It may be a nursing home or a clinic or a medical center or a medical or teaching institution for therapeutic purposes is called a hospitals. So where only we are going to remove and we are going to refix the human organs. Near relatives. So in this act, there is one term which is frequently used that is called near relatives. Who are all called near relatives? A spouse, maybe a husband to wife, wife to husband, son and daughter, father, mother, brother, sister. So only our blood relations, our thick relations is called near relatives. Beyond these relatives, they are called not relatives, they are the third party. Okay, so near relatives. Most of the times, the organs are transplanted upon understanding between the spouse or between the father and son, father and daughter, parents to children, and brother to sisters, brothers and sisters. So they are called near relatives. Next one term, which is very frequently used in this act, is called a registered medical practitioner (RMP). Means a medical practitioner who possesses any recognized medical qualification as defined in Class H of Section 2 of the Indian Medical Council Act 1956. Okay, and is enrolled as a state medical council. So nothing. Simply, it is called as the registered medical practitioner, means a doctor, a physician, or a qualified MBBS doctor. Okay. So these are the frequent term used in this act, the Transplantation of Human Organs Act. Okay. Next, Board of Medical Experts. So this act provides a person who is called as a medical expert to do the transplantation from one person to another person. So they will constitute a board. That board consists a registered medical practitioner. Already we discussed who is called a registered medical practitioner, a civil surgeon in charge of the hospitals in which brainstem death occurred. So any hospital, the brainstem death occur, so immediately they are willingly donating their organs to a needy patient. So any medical practitioner who is working in the hospitals can able to, who is one of the person who is engaged in the board. An independent registered medical practitioner being a specialist nominated by the RMP in class 1 from the panel of name approved by the appropriate authority. So this will be notified in the gazettes. A neurologist or a neurosurgeon nominated by the RMP in class 1 from the panel of names approved by appropriate authority, RMP treating the person whose brainstem death has occurred. Okay, so or an RMP working in a hospital, or an RMP who is treating the patient, or an RMP who is classified as a specialist to do the procedure by the government in the gazette, or board of medical expert to do the transplantation of human organs. Okay. So this is the important one. We must understand who can eligible or able to transplant the human organs. Okay, next part of this act deals about no authority can be granted in cases and inquest is required. So and in unclaimed bodies more than 48 hours in a hospital, or in a present, the authority may be given by the person in charge of management of the hospital, or a prison, or a person authorized in the behalf by the in charge. So there are some person who are not eligible to even donate their organs willingly. Next, appropriate authority. Who are all the appropriate authority to do the procedure? Central government shall appoint by notification in the gazette one or more officers as appropriate authority. So hereafter it is called AA, and the state government for the state. Okay. So appropriate authority are appointed by the central government, by the state government, and authority to perform the transplantation of human organs. Okay, by this act. So this act will appoint in the gazettes, notify in the gazettes the person who are eligible to perform the transplantation of human organs. So what are all the duties of these appropriate authorities? What are all the duties of the AAs? To grant or renew or suspend or cancel registration under subsection 3 of that section of any premises who is approved for doing the transplantation, TOA. So this TOA sometimes it is also misused, so that's why. So it has to be always checked and renewed for doing the transplantation of human organs. If any petition are received, or any illegal procedures are received by the public or by any person or by the appropriate authority itself, they can suspend and cancel the registration of the particular firm for human organ transplantation under section 3 of this act, to enforce standards as prescribed. Okay, so they can time to time they can improve the standards of the human transplantation organs act, to investigate any breach of provisions of the act. Okay, so they can go and inspect, and they can seize and they can seal even if any breach of provisions of this act are happened. To inspect hospitals for examination of the quality of transplantation and follow-up care. To inspect hospitals for examination of the quality of transplantation and follow-up care. Okay, so the appropriate authority are the centrally or state-wise approved authority to regulate these laws throughout the country. Registration of hospitals. So the hospitals, already we discussed which is called hospitals. Or any nursing clinics, any teaching institution or any hospital, if they wish to do the transplantation procedure, they have to apply to the appropriate authority, that is AAA, within 60 days of commencement of this act. Okay. So upon the after commencing this act, any hospitals are eligible to apply for doing this procedure to the appropriate authority. So then appropriate authority may reject the application or suspend the application or cancel the registration with or without the notice. So upon receiving the application, they will check the motto, the aim of the hospitals and the service they are going to cater to the society, and the facilities available and the procedures for doing the procedures and the specialists available for doing the procedures. So after they satisfy, they can give the approval to the clinic, or they can suspend the application for time being for clarification. Even they can cancel the application as well as the registration of the already approved clinics. Appeal within 30 days to central or state government against rejection, suspension, cancellation. If any suspension or cancellation has been done by the AA, so the hospital has the capacity or has the power to appeal on what purpose you have cancelled or suspended, and you can counsel yourself, and you can give all the details about the complaints, and which may be relieved, or which may be again suspended or cancelled. Okay. So this is the role of appropriate authority. So you should not forget what is called appropriate authority, who are there in the appropriate authority, who is appointing the appropriate authority, and what are the duties of the appropriate authority. So the main role of appropriate authority is to enforce the law, the TOA 1994, throughout the nation by doing their duties. Okay. So their major duty, they can receive the application, they can grant the approval, they can, upon receiving any compliance or checking through regular checkup, regular investigation, they can suspend or cancel their approval. And also they can enforce the other laws related to the provisions of the laws related to the TOA 1994. Coming to the offences and penalties under this TOA, Transplantation of Human Organs Act 1994. Removal of organs without authority. So we know appropriate authorities are appointed by the state government as well as central government. They are always there in the play to check whether the laws are enforced as per the provisions of the laws. Okay. Removal of organs without appropriate authority. If you are not informing to the appropriate authority about the removal of organ from the donor, then there will be punishment. The punishment is imprisonment up to 5 years and a fine of 10,000 rupees. So this is one punishment. And for the registered medical practitioner who are doing the removal of organ without knowing the appropriate authority, removal of name from the register of state medical council for 2 years for the first offence, and permanently for subsequent offences. Okay. So for the RMP is also punished, and the center head is also punished if you are removing the organs without the appropriate authority. The role of appropriate authority is very high here. Punishment for commercial dealings in human organs. In the market, there is a commercial dealings. Many people, upon their poverty, they are selling their organs as a for transplanting. So we know many people are selling their kidneys, selling their other vital organs for many other silly reasons. So that is also is one of the offense that has to be punished. Punishment for commercial dealings in human organs. Commercial dealing. Any agent is there, they are always dealing. They are taking the poor people from the rural side of the areas, and they are taking out their kidneys and other organs. That is very, very high offense. Imprisonment for a term between 2 to 7 years and a fine between 10,000 to 20,000. So based on the severity or the commitment, so the commercial selling is prevented, and this imprisonment is also differs. So this is about the offences and penalties. So penalties, offences is for the owner of the premises and for the registered medical practitioner who is engaged in the removal of the organs, or the commercial dealings which has happened between the donor to recipient. So in all cases, it has been prevented. The transplantation of human organs rules 1995 has come into the force upon the act. So 1994 the TOA has enacted and enforced, and after 1 year the rules has come up to regulate the laws. Okay, duties of medical practitioner. Who is medical practitioner? So who is the registered medical practitioner who engaged in the removal and fitting of the human organs from the donor to the recipient. Authorization in form number 1 by the donor. Okay, so that they should have an authorization from the donor in form number 1. Medical fitness certificate. Medical fitness certificate of the donor you have to get. So the medical officer who is engaged in the transplantation first to get an authorization in form number 1. Okay, next, medical fitness certificate form number 2. If donor is a near relative, then form number 3 is filled after establishing relation. So what is the relation, and what motto you are donating your organs? So this has to be filled up. And if donor is spouse is so very close to the donor and recipient, then as a sign sign a certificate in form number 4. So it is serially coming. One is the authorization by the donor, second is the fitness of the donor, third is the relationship of the donor, fourth is the signature certificate of the donor. Fifth, donor has authorized in presence of two witnesses authorized removal of organs from his body in form number 5. So the donor, they have to give authorization, and also they have to give a witness consciously the organ is I am authorizing to take up my organ, and I am donating the organs to the recipients or required persons. So this has to be, the witness also has to be made in a form. Okay, so this is, so all this form has to be filled up and maintained by the medical officer who is engaged in the organ transplantation. There is a lawful possession of dead body by a person having signed a certificate as specified in form 6 and 7. Okay, so after so in many cases the organs are donated by the dead person. Okay, so already they will donate their body, their eyes or their organs for transplantation. In such cases, so the dead body has to be lawfully possessed from the area of the dead to the area of the removal to the burial. Board of experts has signed form number 18. Okay, the board of experts already we discussed what who are the board of expert who is appointed by the central government by the specialities, or registered medical practitioner who is dealing the patient, or the registered medical practitioner who is working in the same hospitals. Okay, so the board of experts expert also has to be signed. Form 9 has been signed by either parents in case of deceased less than 18 years of the age. If a person who is donating his eye or a kidney or any other vital organ upon his death, who may be below 18 years, so in that case, parent has to be signed in form number 9. Form number 10 to be filled for transplantation by live donor other than near relatives. Okay, near relative means that is form number 4, 3, form number 3. So in case of not near relatives, they are unknown person or not related to the person of the recipient. So they have to give a form, separate form, that is form number 10, to be signed by both prospective donor and recipient with a reason of affection and attachment. This has to be approved by authorization committee. Okay, so these are all the serious forms which is there in the TOA Act rules 1995. Okay, so in the Transplantation of Human Act 1994 only describes about the what is called board, what are the different definition of the particular act which is frequently used, what is the composition of board of medical expert, and what is called appropriate authority, their power and duties, and what are the offenses and penalties. So by this the act was over, but the rules help us to understand what are the various forms available and the role of each and every form, who has to be filled and signed, and how it will be maintained. So which is described in the rules of the TOVA 1994. Conditions for grant of certificate of registration. So any hospitals or any clinic or any educational institution, medical educational institution who is engaged in the human organ transplantation, they have to be get a permission or a registration of for performing this duty for this service. They have to get a permission from the central government and state government or the approved authority for their registration for doing the procedures. So what are the requirements? The first requirement is called the general requirements. They should follow some general requirements. What are the general requirements? They should have sufficient surgical staff. So they should have neurological surgical staffs and other surgical general surgeons, cardiology staff, nursing staff, communication system, and well-equipped communication system. Intensivist, because it is a high care procedure, so intensivist is always required. Medical social worker, perfusionist, ophthalmologist are the other persons who are required. So all these persons are only available in the tertiary care hospital, not in a primary care hospital. So an ordinary primary care hospitals cannot be able to get a permission to do the organ transplantation. That is why so organ transplantations are happened only in tertiary care hospitals or multi-specialty hospitals or super specialty hospitals or medical educational institutions or hospitals which are called national importance. So that is why during the organ transplantation and within a particular period of time, the organ has to be taken from the live body or dead body and it has to be transplanted into the recipient body. So the time period has to be maintained. So that is why many of the times it is transported through airway transportation, or we have know many of the very peculiar transportation which has happened for transplantation of organs between the donors and recipients. So the general requirement itself stating that it has all kind of staffs who are working in tertiary care hospitals to the procedures. Non-transplantation program team. There will be one more team called non-transplantation program team. They are not directly involving the transplantation procedure, even though they are required to do the transplantation. What are all the persons? Neurologist, neurosurgeon, medical superintendent, any other hospital staffs, eye donation counselor or grief counselor, corneal surgeons. So the other surgeons are the team which are called as a non-transplantation team. They are also required to do the TOVA, transplantation of human organs. And if you count the department which require for doing the getting the permission to do the transplantation, around the 18 departments are required to have registered as a transplantation of human organs hospitals. So one is neurology, microbiology, mycology, pathology, virology, nephrology, and gastrointestinal surgery, anesthesiology, pediatrics, physiotherapy, immunology, hematology, blood bank, imaging services, clinical chemistry, cardiology, ophthalmology, and psychology. All those departments are required to get permission as well as to do the procedure of the transplantation of human organs. So this enlighten us. So this is not an ordinary or an ordinary service provided by the healthcare sector, which is a highly engaged service. We need nearly 18 specialists to do the procedures. Okay, so this is the also described in the rules of the transplantation of human organs under rules 1995. Okay, and what are the basic equipments required for doing the transplantations? So you need a minimum operating room, which is very much necessary for routine open heart surgery, which includes heart-lung machines and accessories, and slit lamp, specular microscope, operating microscope. And additional equipment required are cell saver, assistant device like IAPP and centrifugal pump, mobile C arm. So these are the basic equipments. And again, it is continuing radioimmunoassay for measuring cyclosporine levels. Because we are, the cyclosporine is one of the immunosuppressant we are giving during the organ transplantation. So, so it is inseparable. So that level is also has to be maintained by means of measuring through radioimmunoassay. And other lab facilities, autoclave, UV lamp, laminar flow is our other equipments required for doing the TOVA. TOVA. So this is about the rules. Provisions are under the rules. The rules clearly help us. What are the duties of medical practitioner and what are the different forms? It is nearly 10 forms. Who are all the person who fill up the forms and give the signature, everything we discussed. And what are all their general requirements and what are all the departments required for doing the transplantation and what are the basic equipments required in doing the transplantation of human organs. So they are all described in the Transplantation of Human Organs Rules 1995. That the act is different and the rules is there under to help the for enforce the act throughout the country. There are some interesting story which tells us what is the impact of the law, why we need to have this law, and why we have to do this kind of enforcement offenses and penalties for each and everyone who are committing mistakes by enforcing these laws. Because there are many cases we come across. One is the NMC Hospital, Noida, in the year 1998. Everyone knows kidney transplantation racket has happened. Then Kakar Hospital, Amritsar in Punjab, kidney transplantation racket was happened, and the kidney transplantation racket in 5 hospitals in Hyderabad, 1993. So these are all called a medical disaster, and there are many that is social medias also. The news has flashed. See here, China harvesting poisonous organs for transplantations. So, which was published in a London news, stating that China is doing illegally transplanting the poisonous organs. And this is the news which is in Andhra Pradesh. The two men, they dug up around 400 bones found in pits. All the bones are child bones near the hospitals in the Bhopal. So this is again very pathetic news we heard. So the organ transplantation are illegally happened. Many are killed and many are unknowingly involved in the transplantation. So this was stopped by this act. Why this act was enacted? Because of the story of human transplantation racket in the hospital. Many hospitals in India and abroad, they illegally do these procedures, and many of them have lost their vital organs. So this act and laws are enforced to control the human trafficking. In USA, a total of 97,179 patients were waiting for a transplant of September. So this case tell us following is a list by type of transplant needed. So many people need kidney is a kidney failure patient. Always they need kidney for transplantation, and liver transplantation is the second one, as largest organ which is transplanted largely. Around 16,702 patients are waiting. It is an US report. And pancreas, kidney and pancreas, intestine, heart, lung. So these are all the other vital organ which is also can be transplanted, but the patients are very less when compared with the kidney and the liver. So, and the next thing, number of transplants performed during 2006. So this will help us to understand how much patients are needy patients are there, how much surgery has been done. Around 17,092 kidney transplantation are done in US, and in a particular up to 2006. and like liver transplantation, pancreas, and other organs are also transplanted by the by a huge level by enforcing these laws and rules. So, based on the requirement and based on the transplantation rocket cases, so the government, as per the government, Delhi High Court, has made a judgment stating that review the provisions of the Transplantation of Human Organs Act 1994 and the Transplantation of Human Organs Rule 1995. So they have submitted the report of Transplantation of Human Organs Act Review Committee. So this case flashed why the hospitals are indulging illegally transplanting the organs. What is the provisions available in this act? Why they are contravening the act and they are doing this practice as illegally? So the government has passed judgment stating that you put a committee and get a review from the committee, and we can improve the provisions of the act as well as the rules of the transplantation of human organs. So with this, we will end up our class today. The continuation of the THOA 1994 and the Medical Negligence Act I will discuss in my next class. In my next class, which falls on 22nd, that is Monday afternoon 2 to 4. So with this, I thank the participants or the students who is undergoing this MBA hospital management for your patient listening. If you have any queries, you can ask me now. Otherwise, we will wind up. Audience, any queries? Sivaranjani?
No, sir. Thank you, sir.
Yes, ma. Thank you. So with this, we'll
Thank you, sir.
wind and we'll meet on 22nd afternoon. I'll
Sure,
continue
sir.
the TOVA 1994 and medical negligence and that is 22nd Monday. With this, I
Okay.
will finish my portion. Okay. Thank you all.
Okay. Thank you, sir.
Thank
Thank
you.
you so much.
Good afternoon, everyone. Am I audible? Hello.
Yes, sir.
Yeah, thank you. So, is Madam Nivedita there? Hello. Am I audible to others at least? Somebody told yes. Hmm? Or should I go ahead or maybe I'll look? Hello, am I audible? ಇದು ಒಂದು ನಂಬರ್ ಹಾಕಿದ್ದಾರೆ ನಿವೇದಿತಾ ಅಂತಲ್ಲಿ yes ಅದನ್ನ ಕ್ಲಿಕ್ ಮಾಡ್ರಿ ಇದು ಕ್ಲಿಕ್ ಇದೆ share keeping the PowerPoint presentation view slideshow. Good afternoon, everyone. First of all, before starting the class or lecture or discussion on medical ethics, I like to thank Madam Nivedita and Dr. Gopal from Mother Teresa for having given the opportunity for me to share something about medical ethics. So these are the contents we are going to discuss for another 1.5 to 2 hours. Maybe at the end I can take 1 or 2 questions. So these are the main subheadings we are going to discuss. Am I audible? இல்லை நான் உங்களுக்கு திரும்பி ஃபோன் பண்ணி கேளுப்பா ஸ்லைட்ஸ் வருதா ஆட் பண்ண
சேட் பாக்ஸ் எங்க இருக்கா? லிங்க்ல நான் ஜாயின் பண்ணேன் சார்.
ஓகே ethics
வீடியோ கால் வந்து அப்பப்போ இதில் பார்த்துக்குங்க. நீங்கள் வரீங்களா இல்லைன்னு அப்பப்போ இதை பார்த்துக்கோங்க. இதை ஓப்பன் பண்ணிக்கிட்டே இடையில இடையில ஓப்பன் பண்ணி நம்ம இல்லை இருப்போமான்னு
இது போக
பார்த்துக்கோங்க.
மாட்டேங்குது. Yeah. Am I visible? Am I audible?
Start from the first session.
ஸ்லைடே எனக்கே தெரியல ஸ்லைடு.
இது பண்ணும்போது இது பண்ணணும் சார். இடையில செக் பண்ணிக்கணும்னா அப்போ இது வைப்போம். திருப்பி வாங்க.
இடையில பார்க்க வேண்டாம். Am I audible?
Yes, sir.
Okay. Thank you all. So good afternoon all. I welcome all the students, scholars of MBA Hospital Administration. First of all, I like to thank Madam Nivedita and Dr. Gopal from Mother Teresa for having given me the opportunity to share my knowledge about these things. I think for another 1.5 hours, we'll be discussing something about medical ethics. So ethics is a very large and complex field of study with many branches and subdivisions. Medical ethics is the branch of ethics that deals with moral issues in medical practice. No practice The conventional laws, customs, and courtesy and the code of conduct governing the relationship of the physician with his professional colleagues. In recent times, medical ethics has been greatly influenced by developments in human rights. Physicians frequently have to deal with medical problems resulting from violations of human rights, such as forced migration and torture. Medical ethics is also closely related to law. Quite often, ethics prescribes higher standards of behavior than does the law. And occasionally, ethics requires that physicians disobey laws and demand unethical behavior. So, we'll see the importance of medical ethics. Ethical principles such as respect for persons, informed consent, and confidentiality are basic to physician-patient relationship. Application of these principles in specific situations is often problematic since physicians, patients, and their family members and other healthcare personnel may disagree about what is right way to act. Beneficence is do good. The practitioner should act in the best interest of the patient. The procedure be provided with the intent of doing good to the patient. Patient's welfare is a first consideration. Beneficence in general means do good. Next is confidentiality. Based on loyalty and trust, maintain confidentiality of all personal, medical, and treatment information. We come to know a lot of information about patient. We are not supposed to talk to others about the patient's information we get when we are treating the patient. Information to be revealed for the benefit of the patient and when ethically and legally required. Unless it is legally required, we are not supposed to tell the information about patient to anyone not concerned in giving care. Do not harm or non-malfeasance. Do not harm, do not do any harm. Opposite of do good. Make sure that the procedure does not harm the patient or others in society. And when we know this procedure is going to harm the patient, we are not supposed to do. So do not harm is another important principles we need to keep in mind. Principle of medical ethics. When interventions undertaken by physicians create a positive outcome, while also potentially doing harm, distributed equally among all groups in society. So ethical codes, we have a big history of how it started, when it started. It started a long time back. You can see here in 5th century, Hippocratic Oath, Nuremberg Code. This is the history of how the ethical codes or principles we are following today have evolved over the period of time. Declaration of Geneva, Universal Declaration of Human Rights, Helsinki Declaration, International Code of Medical Ethics, Indian Medical Professional Etiquettes to Rule 2002. Big history, long history. Declaration of Geneva, adopted at World Medical Association General Assembly in 1948, amended in 68 and 2006. Declaration of Physicians' Dedication to the Humanitarian Goals of Medicine. Helsinki Declaration, set of ethical principles regarding human experimentation, developed by the World Medical Association 1964, undergone 7 revisions. This is a little older slide. More specifically addressed clinical research reflecting changes in medical practice from the term human experimentation used in Nuremberg Code. International Code of Medical Ethics given by World Medical Association applies to both in peace as well as war. It codifies the duties of a physician in general, duties to patients and colleagues. MCI Regulations 2002, Medical Council of India notified the Indian Medical Council Regulations 2002, last amended in 2010. Declaration: each patient at the time of making an application for registration and the provisions of the Act shall be provided a copy of the declaration and shall submit a duly signed declaration. Duties and responsibilities of physician in general: character of physician, uphold dignity and honor of his profession, render service to humanity. Person with recognized qualification can only practice modern system of medicine, maintaining good medical practice, render service to humanity with full respect for the dignity, maintenance of medical records, maintain the medical records pertaining to his indoor patients for a period of 3 years, records to be given within 72 hours if required by patients or legal authorities, maintain a register of medical certificates giving full details of certificates issued, display of registration numbers. I'm not used. It's okay, thank you. We'll continue. Highest quality assurance in patient care, exposure of unethical conduct, payment of professional services, personal financial interests of a physician should not conflict with the medical interests of patients, evasion of legal restrictions. Physicians shall observe the laws of the country. Duties of physician to their patients. Obligation to the sick. Always respond to the calls of the sick. Ailment not within range of experience, he can refuse treatment or refer. Patience, delicacy, and secrecy. Patience and delicacy should characterize the physician. Secrecy of patients to be maintained except when required by laws. We'll continue with again the duties of the physician to their patients. Prognosis: neither exaggerate nor minimize gravity of patient's condition. Do not neglect the patient. Physician free to choose. Once undertaken, should not neglect the case. Respond to request in emergency. Duties of physician in consultation: avoid unnecessary consultation. Consulting pathologists, radiologists, or asking for lab investigation should be done judiciously. Consultation for patient benefit. Punctuality in consultation. Statement to patient after consultation. Treatment after consultation. Responsibilities to each other. Dependence of patients on each other. Should consider it as a pleasure and privilege to render gratuitous service to all physicians and their immediate family dependents. Conduct in consultation: respect should be observed towards the physician in charge of the case and no statement or remark be made. Consultant should not take the charge of the case. Appointment of the substitute: only when he has the capacity to discharge of sanitary public health laws and regulations, public health and community health, should enlighten the public concerning quarantine regulations and measures for the prevention of epidemic and communicable diseases, pharmacists, nurses. What are the unethical acts or advertising? Running an open shop, rebates and commission, secret remedies, human rights, euthanasia, printing of self-photograph or any such material of publicity in the letterhead or on signboard of the consulting room or any such clinical establishments. Not endorse any items formal announcement in press on stating practice, on charge of change of type of practice, on changing address, on temporary absence from duty, on resumption of another practice, on succeeding another practice, public declaration of charges. Further, we'll continue with unethical acts. May patent the items, but it shall be unethical if benefits are not made available in interest of society. A physician shall not give or receive any gift, gratuity, commission, or bonus in consideration of or return from referring, recommending, or procuring any patient for medical, surgical, or other treatment, should not prescribe or dispense secret remedial agents of which he does not know the composition, etc., should not assist nor be in a party to either infliction of mental or physical trauma or concealment of torture by other person. Practicing euthanasia shall constitute medical unethical conduct. However, on specific occasion, the question of withdrawing support devices to sustain the last sentence, I am not in a position to see. Last line.
Zoom in பண்ணிக்கலாம்.
Sorry for interruption. Sustain other sentence not complete every time. So we'll continue. So what are the misconduct? We talk of violation of regulations, adultery or improper conduct, conviction in court of law, sex determination test, signifying signing false professional certificates, reports, and other documents. Any registered practitioner who is shown to have signed or given under his name and authority any certificate. Punishment and disciplinary action. Complaint is first heard by the appropriate medical counsel. During the inquiry, the full opportunity is given to registered medical practitioner to be heard in person or by pleader. Decision has to be taken within 6 months. Appropriate medical counsel gives decision according to the case. During pendency of complaint, the appropriate counsel may restrain the physician from practicing. Complaints heard by Medical Council of India, an apex body. If appropriate medical counsel's decision is not acceptable, the petitioner or the RMP may then appeal to MCI within 60 days from the date of receipt of order. If no action is taken by appropriate medical council within 6 months, then the case may directly be appealed to MCI. Punishment given by the appropriate medical council includes warning, reprimand, cancel of registration, temporarily or permanently. Public health ethics. Key issues in public health ethics: disparities in health status, access to health care and to the benefits of medical research, responding to the threat of infectious diseases, international cooperation in health monitoring and surveillance. Key issues in public health ethics: participation, transparency, and accountability, exploitation of individuals in low income countries, health promotion. Public health ethics, general moral considerations: providing benefits, avoiding, preventing, and removing harms, producing maximal balance of benefits over harms and other costs, distributing benefits and burdens fairly, and ensuring public participation. Public health ethics, respecting autonomous choices and actions, including liberty of action, protecting privacy and confidentiality, keeping promises and commitments, disclosing information as well as speaking honestly and truthfully, building and maintaining trust. Ethical principles in public health: harm principle, principle of least restrictive means, reciprocatory principle, transparency principle. Harm principle: the only purpose for which power can be rightfully exercised or any member of a civilized community against his will is to prevent harm to others. His own good, either physical or moral, is not a sufficient warrant. Least restrictive means: a variety of means exist to achieve public health needs. Education, facilitation, and discussion should proceed coercive methods. More coercive methods should be employed only when less coercive methods have failed. The principle has been enshrined in Syracuse Principles, a set of internationally agreed upon legal principles. Reciprocatory principle: complying with public health requests may impose burdens on individuals. Need to compensate. Society must be prepared to facilitate individuals and communities in their efforts to discharge their duties. Transparency principle: manner and the context in which decisions are made. All legitimate stakeholders should be involved in the decision-making process, have equal input into deliberations. Decision-making manner clear and accountable. Research ethics, principles in ethical research. Social value: the study should help researchers determine how to improve people's health or well-being. Scientific validity: the research should be expected to produce useful results and increase body of knowledge. Good research is reproducible and has minimum bias. Fair subject selection: favorable risk-benefit ratio. Any risk must be balanced by the benefits to subjects and or the important new knowledge society will gain. Independent review, a group of people who are not connected to research are required to give it an independent review. Again, continuing with research ethics, we have informed consent. Subject must be competent. The researcher must give a full disclosure. Subjects must understand what the researcher tells them. The subject's decision to participate must be voluntary. Respect for enrolled subject. I think it is the expansion of these three principles of autonomy, beneficence, and do good, do not harm, and justice. And even after explaining the procedure to the patient, if he or she does not want to take part in the research, he or she has every right to withdraw at any time of the study without foregoing the treatment the patient was getting, and there should be provision for compensation if there is any research related injuries for the patient. These things are clearly explained to the patient before they are recruited for the study. Anytime patient has got the right to withdraw from the study, all these things are clearly told in their own language. A copy of these things are given to the patient before enrolling them for the study. ICMR guidelines 2006 is a old one. Actually, the latest one is 2017. We have the latest guidelines. There is one PDF. I request all the participants to go through that. The statement of ethical guidelines for biomedical research on human participants shall be known as ICMR code and shall consist of the following: statement of general principles on research using human participants and biomedical research, statement of specific principles on research using human participants in specific areas of biomedical research, ethical guidelines for biomedical research. All institutions in the country which carry out any form of biomedical research involving human beings should follow these guidelines in letter and spirit to protect safety and well-being of all individuals. It is mandatory that all proposals on biomedical research involving human subjects should be cleared by the appropriately constituted institutional ethics committee. So what are the general principles? Principles of essentiality, principles of voluntariness, informed consent and community agreement, principles of non-exploitation. Okay, sorry for the interruption. Public principle of accountability and transparency. You've seen this. Principles of institutional arrangements, principles of public domain, principles of totality of responsibility, principles of compliance. Specific principles of clinical trials of drugs, devices, vaccines, diagnostic agents, and herbal drugs, epidemiological studies, human genetics and genomic research, transplantation research, including fetal tissue and xenotransplantation, assisted reproductive technologies. And coming to the consent, legally valid consent given a person himself if above 12 years, conscious, mentally sound. Given by patient, guardian or friend, if person is less than 12 years, or is unconscious or is insane. Legal consent should be given freely, voluntarily, and directly. Is given without fear, force, or fraud. Is a written consent. Institutional ethics committee basic responsibilities. Ensure competent review of proposals. Ensure execution free of bias and influence. Provide advice to researchers. So usually it will have 8 to 12 members and multidisciplinary. From various disciplines they will be representing. So usually there will be a chairman, 1 or 2 basic medical scientists, 1 or 2 clinicians from various institutions, 1 legal expert or retired judge, 1 social scientist or representative of non-governmental agency. So institutional ethics committee, what do they do? Review process through formal meetings, submission of application, prescribed format with study proposal, at least 3 weeks in advance they have to submit, decision making process and interim review. Grouping in the slides in relay. Where is it? Okay, there is something like case studies on that as well. Cut printing. Okay. Okay. Very how to mute? Mute. I think I have finished the formal presentation. I can take 1 or 2 questions if you have any.
Sir, regarding informed consent,
Yeah.
patient can withdraw the informed consent at any time.
Yeah.
But how about parallelly towards the institution or organization or hospital? How long it has to be stored or documented? Validity of the informed consent.
Usually it is for 3 years, any records are kept. And patient can withdraw any time. Like they have recruited the patient, initial stages also you can withdraw consent, or after into the study also you can withdraw the consent. It does not compromise the treatment patient gets in the same hospital.
I mean, towards the organization, how long they have to store, document that consent form?
3 years, sir.
Okay, thank you, sir.
Madam Nivedita, is she online? Okay, we'll close the meeting. I think I have done justice to the task. If you don't have any questions, the participants, I think we can close the session.
Good afternoon.
Hello, sir.
Yes, ma'am.
Voice is not audible, sir. Now it is okay.
Okay, ma'am. Okay.
Yeah.
Just a minute, ma'am. I'll start.
Okay, sir.
Yes. Uh, I'm sharing now. Yes, good afternoon once again, all of you. I'm happy here again joining with you in the last one more session. I'm going to talk about biomedical waste management, which is one of the portion in our syllabus. So, with this, I'm going to talk about the biomedical waste management. We'll start with a small introduction about what are the different kinds of waste. Okay. uh, Waste, something which is not put into proper usage at a given time is called waste, even it has usage in a later time. But if you are not properly packing it or keeping it, then it will become a waste product. Waste, as per the general uh, phenomena, it is classified into solid, liquid, and gaseous waste. And if you go to solid waste, it may be a household or industrial or biomedical waste, where the biomedical waste or hospital waste lies. Okay, so it is one of the solid waste. Biomedical waste, any waste which is generated during the diagnosis, treatment, or immunization of human beings or animals, or in research activities pertaining thereto, or in production or testing of biologicals. So, which is otherwise called biohazard. So, we all know in the hospitals how much the biomedical waste is produced. The example is given here. We are using a sharp blade for doing the minor OT procedures, and a lot of needles, syringes. So, many things are there. And what are the causes of waste? So, if it is improperly packed, or if it is not segregated properly, and the waste is not treated in such a way that it is not injurious to the or hazardous to the environment, or if it is not disposed properly, then the biomedical waste will become uh, a dangerous thing for the human beings. Again, the biomedical waste are classified into many types. So one is infectious waste, another one is the pathological waste, sharps, pharmaceutical waste, genotoxic waste, chemical waste, waste with high content of heavy metals, pressurized containers, and radioactive waste. So there are many categories are there in biomedical waste, and each categories are coded with the different coding systems, colors, and bins. So thereby we have to segregate the biomedical waste into its classified types, and we have to properly segregate and treat it. The first one waste is infectious waste. Infectious waste suspected to contain pathogens. That is called infectious waste, which is very dangerous because it contains disease causing microorganisms, bacteria, viruses, parasites, or fungi in sufficient quantity to cause diseases in susceptible host. So this waste are signed by the signboard is given here. Infectious waste notify public health authority in case of damage or leak. So the container should be a closed one, and it has to be incinerated, or it has to be treated in a special way. Doing that, the microorganism or the pathogen has to be killed. Then only it has to be disposed into the soil or environment. So this is the major waste which is produced by medical industry, and this category includes cultures and stocks of infectious agents from laboratory work. So in the hospitals, we know the various culture we are doing to identify the sensitivity of the culture against various antibiotics or chemicals. So this is one routinely done in microbiology lab, pathology lab, and we are taking waste from surgery on patient with infectious diseases. So a lot of the infectious tissues or uh, that's cells which is admixed with the surgical things. Infected animals from laboratories. So these are also included in the infectious waste. Second category of biomedical waste is the pathological waste. Pathology, it's a department where they are doing the biopsy or the cell culture, and they're identifying the disease-causing organisms and how the cells and tissues turns into. So it consists of tissues, organs, body parts, human fetuses, and animal carcasses, blood, and body fluids. So where we take body fluids like blood, serum, and urine, and other body fluids, cerebrospinal fluid, everything they are taking and doing the cells and tissues types and how they changed. So that is also one of the pathological. That is one of the waste in the biomedical system. That also has to be treated in such a way it should not contaminate the environment. Third kind of biomedical waste is called sharps. Sharps, that is any object uh, which has sharp edges may able to injure the mm, tissues. There are these are the items that could cause cuts or punctures, wounds, including needles, scalpels, and other blades, knives, infusion sets, saws, broken glasses, and nails. So this is a very common surgical items we are using in the medical industry or in the hospitals, and this is a kind of waste that has to be separately packed separately. That segregation for sharp waste is another important criteria. We must be able to understand how to segregate and dispose the biomedical waste. The next kind of waste is pharmaceutical waste. It includes expired or unused drugs, splits, and contaminated pharmaceutical products, vaccines, and serums. So there is a chance for a lot of contamination during storage and the distribution of the medicine to the patients. So thereby, the contaminated items are daily checked and it is segregated from the good one, and that has to be disposed in proper way. And there are chance for expired drugs, so the drug has to be packed separately and it is disposed. Unused spilt, so that is usually we have, and this and all has to be segregated. It is a kind of waste. The next kind of biomedical waste is genotoxic waste. Genotoxic waste is highly hazardous and may have mutagenic, teratogenic, or carcinogenic property. This is very important. The pre-waste waste, say for example, sharp waste may make injury if it is not properly disposed. These pathological and infectious waste may cause some infections or diseases that can be even treated by some antibiotics by using some treatment protocols. This pharmaceutical waste, the contamination may cause again infections that can be also treated even if it happened. But the genotoxic waste is a very important thing where we don't have any options to treat because it causes cancer. So now this is a separate class of waste is classified in the biomedical waste management systems. Drugs or agents which cause mutagenicity in the human cells and tissues. Teratogenic effects means drugs which cause abortion is called, and carcinogenic properties. So these genotoxic substances are very peculiar substances that has to be notified and has to be properly segregated and disposed. Raises serious safety problems both inside hospitals as well as after disposal. We cannot easily throw out in the soil and should be given a special attention. It includes certain cytostatic drugs, vomit, urine, and feces from patients treated with the cytostatic drugs chemicals and radioactive materials has to be properly disposed. It has to be sterilized and disposed, or it has to be incinerated and disposed. It should not be directly thrown into the soil. It may cause contaminations and again serious problems to the publics. And another kind of waste in the biomedical waste management system is chemical waste. It consists of discarded solid, liquid, and gaseous chemicals. So we may use a lot of chemicals in the hospitals for sterilization or for fumigation and for cleaning purposes, and that has to be segregated. Chemical waste may be hazardous or non-hazardous. It is considered to be a hazardous if it has at least one of the following properties. Even if it is toxic, maybe a corrosive acid and pH more less than 2 and bases more than 12. And if it is inflammable and if it is reactive with the human cells and tissues and genotoxic, so that has to be checked. Even nowadays, the bottles or the container which holds these substances, which indicates whether it is hazardous or not, how to dispose the things. The next kind of waste with the high content of heavy metals. So you all know what is called heavy metals like lead, arsenic, copper, iron. Metal which cause poisonous effect upon ingestion or upon introduction to our body system, that is called heavy metals, toxic metals. It represents a subcategory of hazardous chemical waste and it is usually highly toxic because we will have arsenic poisoning, lead poisoning, uh, iron poisoning, and many poisonings are there. It includes batteries having lead, broken thermometer which is having mercury, blood pressure gauges which is also having mercury. So mercury, lead are heavy, considered to be heavy metals. If it is broken or it is ingested in one or other way by the human being, definitely it causes heavy metal poisoning, and it causes leading to death also. So this is also has to be seriously watched. Waste which is having high heavy metal content. Okay, and next is the pressurized containers. So in hospitals, we may come across a lot of pressurized containers like cylinders, gas cylinders, or oxygen cylinders, some of the sprays which is having pressurized gases. So they also considered as one of the waste containers, uh, waste categories. So this is coming under eighth category of waste, biomedical waste, that is pressurized containers. Many types of gases are used in healthcare and often stored in pressurized cylinders, cartridges, and aerosol cans. Most common gases used in healthcare includes anesthetic gases, ethylene oxide, oxygen, compressed air. So this is commonly used during surgical procedures or surgery, minor OT, major OT, and for even treatments. So this how these containers has to be disposed. And the final waste in the hospital waste management system is radioactive waste. Very seriously, we have to watch. We know what is the various adverse effect of radiations. So it includes the X-rays, alpha and beta particles, and gamma rays emitted by radioactive substances. Alpha particles are heavy positively charged particles, and it includes proton and neutrons. They have low penetration power and are hazardous to human mostly when inhaled or ingested. So the radioactive in the waste management system, the radioactive substances or radioactive waste are denoted by this symbol, this black color symbol. And the previous one we use the same black color with another cautious symbols. So that has to be under each and everyone should understood and act. And if you see the beta particles of the radioactive materials are negatively or positively charged electrons with a significant ability to penetrate human skins. So if it is penetrate human skins, they affect the health of the that is intracellular proteins and proteinous substances in the body. It's very dangerous beta particles and gamma particles. They are all called electromagnetic radiation, similar to X-rays, but to shorter wavelength, their penetrating power is also high, and it leads shielding is required to reduce their intensity. So always we know that when we work or when we expose to our body to radioactive substances, we should wear the clothes, aprons, which is protect against the penetration of these kind of particles. So, what are the various sources of biomedical waste? And the major source is hospitals and healthcare centers. So, we all know we are working in hospitals. So, we know the various kinds of waste, how they are going to be segregated, and each and every healthcare professionals are involved in it, and they should be properly educated how to segregate and pack the waste and to dispose. And blood banks, biotechnological institutions where they are dealing with a lot of microorganisms. And the household waste, we can throw it like this picture. Industries, educational institutions, research centers, they also generate biomedical waste in substantial quantities. Apart from the hospital, the research center, they are involved in the biomedical research or medical research. Definitely, there may be chance for pathogens, animal tissues, organs, body parts, so body fluids and blood collections from the animals and human beings. So that also considered to be a minor source of biomedical waste. Blood banks and clinical laboratories. Blood banks and laboratories generate most of the categories of biomedical waste because all the collected blood or blood products are not going to be used at a proper time. There may be chances for expiry, and that has to be properly noticed and disposed. The sources of biomedical waste generated in the healthcare setting that we understand from these topics, and the effect of biomedical waste. What would be happen when we won't have proper idea about the segregation and disposal of the biomedical waste? The improper or management of biomedical waste causes serious environmental problems in terms of air pollution, water pollution, as well as land pollution. In all the that is living things, we all living creatures require all those things: air, water, and land. So all the three important things are going to be affected, and in one way which the effects continues. The air pollution is the first kind of pollution which caused by biomedical waste, which is caused by both indoors and outdoors. Biomedical waste that generates air pollution is the of three types: biological, chemical, and radioactive. So these are all everyone knows. And land pollutions, and come to this category: method of disposal of biomedical waste and their segregation. So this is very important. Each and every healthcare professional must know that. So what are the different category of biomedical waste, how they have to be segregated, and how they have to be disposed. The category one is the human anatomical waste, that is human tissues, organs, and body parts, fluids. It is a first category of biomedical waste that has to be disposed, treated and disposed by means of incineration. Incineration using a furnace, and followed by deep burial. And category two, which is the animal waste, animal tissues, organs, body parts, carcasses, bleeding fluids, blood, experimental animal used in research. The waste generated in veterinary hospitals also includes as an animal waste, and this is also incinerated in a furnace, followed by deep burial or deep burial. Sorry, either incineration or deep burial. Either these things we have to follow. And category three is the microbiology or biotechnology waste. That is waste arises from laboratory cultures, specimens of live microorganisms, human and animal cell cultures used in research, infectious agents used for research, industry laboratories, waste from production of biological toxins, and devices used for transfer of cultures. So we may use a lot of devices to transfer culture, like the glassware equipments. Everything has to be segregated in category 3 as microbiology waste or biotechnology waste. This has to be treated by means of local autoclaving. So usually it is being done in each and every hospitals. We have autoclaving or microwaving or incineration based on the products. If it is culture, it is incinerated, or it is glassware or the equipments used for transfer cultures, we can do autoclaving. Thereby we can kill the infectious organisms. Category 4 is waste sharp. That is sharp waste: needles, syringes, scalpels, blades, glass pieces that may cause puncture and cuts or wounds when we handle it. This includes both used and unused sharp items. So they are They are treated by means of disinfecting. That is, disinfecting means treating the sharp biomedical waste products using chemicals, disinfectant like xylene, xylol, any other disinfectant fluids. And after disinfectant, the discharge fluid is discharged into drains. It should not be contaminated the open drainage systems. Category 9 is called incinerated ash. Ash which is obtained upon biomedical waste incineration. That ash has to be disposed in municipal landfill. So it should not be thrown at the open soil. So it has to be packed and transported to the municipal area where they have a land to that is bury this kind of ashes. Category 10 is the chemical waste. Chemicals used in production of biological, chemicals used in disinfecting as an insecticides. So these chemical waste are treated by means they can be that is they can be discharged through drains for liquids and a secured landfill for soils. If it is soil, it has to be buried, and if it is liquid, in a closed drainage system, it has to be washed. We are going to complete the portion. What are the steps in the management of biomedical waste? So, the first thing, take a survey of waste generated. What kind of waste are possible waste products to be generated in the healthcare system or in the healthcare center. And after the survey, we must be able to understand that the different kinds of waste which are going to be um, come out of the service. So accordingly, it has to be segregated. Segregation of hospital waste is very, very important. Hospital like institutional hospitals or multi-speciality hospitals or hospitals with national importance, they have proper waste management teams and disposal teams. So they are keenly watching, and they give advice to the workers who are involved in the waste production. And they have been supplied the different bins, different colored bins, dustbins, and they have been advised to segregate the waste. And after it is segregated, collection and categorization of waste has to be done by the biomedical waste management team in the hospitals, and storage of waste not beyond 48 hours. So it has to be properly disposed. We cannot store it like in our kitchen or in our house or home. We may dispose the waste even a week after, but this is not in case of biomedical waste management system. So immediately it has to be disposed either by daily hours or hourly basis or daily basis, or at least 48 hours once. Then transportation of waste, how it is going to be transported from the waste generation to the area of treatment. So most of the times it is treated and disposed. So from the area of production to the treatment site, how it is going to be safely transported, that also has to be planned. And finally, the treatment of waste has to be done. And as we studied the different treatment system for different categories of waste products. And color coding for segregation of biomedical waste. This is again another important thing. As a healthcare worker, each and everyone must know that the different color bins or color bags we can see in the hospitals. So what is the indication? So yellow color bin is used for human and animal anatomical waste, tissues and organs, microbiology waste, cultures, and soiled cotton, dressings, linen, beddings. So these are all infectious waste. So that has to be kept in yellow color bin. The color coding is it is an international color coding system. Each and every hospital has to be followed, and so the yellow color is for infectious tissues and infectious microorganisms. The treatment is for yellow color is incineration, follow or deep burial. So if you have a proper incinerating systems, so you can incinerate, or if you don't have, you should have a proper surface area or soil place where you have to make a pit, and you have to bury the waste. The next color coding system for segregation of biomedical waste is red, which is for tubings, catheters, and IV sets. So, in the ward as well as in the theater, operation theater, there is a chance for these kind of surgical gadgets. So that has to be segregated in red color bin. And how they are going to be disposed? First, they have to be autoclaved, or they have to be sterilized by microwaving or by chemical treatment. There are many chemical sterilizing agents, starting from formaldehyde and hydrogen peroxide, and we have many kind of sodium hypochlorite. So many surface sterilizing agents are there, or microwaving, or autoclaving, or a commercial one we are using. So we have to first treat the waste, then followed by we have to dispose. And blue or white color, next color coding system, that is meant for sharp waste, needles, syringes, scalpels, and blades. They are coming under sharp waste, some broken glass pieces, ampoules. So they are called sharp waste. So this kind of waste has to be treated by means of autoclaving or microwaving or chemical treatment, or and destruction and shredding. So that is we have to crush and put into the soil. The final color coding is the black color. Black color is for discarded medicine, cytotoxic drugs, incineration ash, chemical waste. Okay. So because the chemical waste or cytotoxic drugs cause teratogenic effects, carcinogenic effects, mutagenic effects. So these waste are very highly dangerous waste. So that is why it is coded by black color, and it is disposed in secured landfill. So the amount of depth you have to dug out from the soil, and you have to fill with the soil. This has to be done to treat the waste. So this is the 4 different color bins are there. Already we discussed yellow, red, blue, black. Yellow, red, blue, black. And this hazardous symbol is already given in all the containers and bags, as well as the items what we are using. So this hazardous material has hazardous symbols are there. This is a cautious symbol which indicates us which is an hazardous material which may cause infectious diseases or serious injury to the human beings when we contact. So this bin color we can see in the hospitals, each and every hospitals. The biomedical team will go on the around the hospitals as a rounds, and they will check. There is a research article about the biomedical management. They conducted a cross-sectional study among the hospitals. They are having more than 100 beds in Allahabad city on their knowledge, attitude, and practice about biomedical waste management among healthcare personnel. So this is their title, and they checked how far they are very aware about the waste and its management. And they take a medical personally, which includes doctors, nurses, laboratory technicians, and sanitary staffs. They are the key staffs. They are involving in the waste production and as well as waste management. What is the result, which is quite interesting? Doctors, nurses, and laboratory technicians have better knowledge than sanitary staff regarding the biomedical waste management system. Because they are well educated and they are doing handling itself. The cautions, they are reading the cautions, and they are knowing how to dispose the waste than the sanitary staff. Knowledge regarding the color coding and the waste segregation at the source was found to be better among nurses and laboratory staffs as compared to doctors. This is another thing. And hospitals like Jipmer, doctors are handling all those kind of products, like the sharp edges products, or even the infectious items and all. But they don't know how to segregate the waste, how to follow the color codings. That is a major problem. If you miss up, then, or if you mismatch it, then definitely there won't be problem in the treatment of waste. Regarding practice related to biomedical waste management, sanitary staff were ignorant on all the counts. So that has to be kept in our mind. when we work with the hospitals, definitely we should educate and improvise the sanitary staff in the waste management. Because most of the times they are roaming around, and we have to inform them when anybody asks the food waste where to dispose, and the medical waste, the used cottons, surgical gloves, where to dispose. These things, they have to be well aware and dispose these things. Thank you everyone for your patient listening. With this, I am going to end my presentation about biomedical waste management system, so which is there in our syllabus. Thank you. Hello. Hello. I have finished my class. If you have any queries, you can ask now. Otherwise, we will wind up the class. Anybody else? At least you just reply me, so that I can able to understand that you are in the class. Anybody else in class? Deepthi?
No, sir. Thank you, sir.
Okay, thank you. Okay. Shall we wind up?